अमरावतीला
Am I audible to all?
Yes, ma'am.
Okay. Good morning, all. Myself, Dr. Rutuja Ramesh Sopne, PG first year student of Prasuti Tantra Evam Strirog Department. Welcome you all for our national webinar SUPRAJA 2022 towards healthy progeny, an integrative approach of Ayurveda in pregnancy. On behalf of Honorable Shri Annasaheb Dange, Ayurvedic Medical College and Post-Graduation Research Center, Ashta. Thank you, ma'am, Dr. Meera Bide, ma'am, MUHS Observer, for joining us.
I welcome our Honorable Principal, Dr. Ashok Wali, sir, HOD of Strirog Department, Dr. Dilip Katre, sir, HOD Research Department, Dr. Anjali Upadhyay, ma'am, Dr. Jayant Kharat, sir, Dr. Khalche, sir, Dr. Swati Kamath, ma'am. I request Dr. Katre, sir, to give flowers to our Honorable Principal, Dr. Ashok Wali, sir. I welcome Dr. Anjali Upadhyay, ma'am, HOD of our Research Department. I welcome Dr. Inamdar, sir, HOD of Rasashastra Department. I welcome Dr. Jayant Kharat, sir. Light is a symbol of brightness and prosperity. So for enlighten the lamp, I invite our honorable principal and organization chairperson of our webinar, Dr. Ashok Wali sir, HOD of Prasuti Tantra Department, Dr. Dilip Katre sir, HOD of Research Department, Dr. Anjali Upadhyay ma'am, PG Director, Dr. Jayant Gharat sir, HOD Rasashastra Department, Dr. Inamdar sir, and all the dignitaries. Please enlighten the lamp to get blessings of Lord Dhanvantari. Sir. Please enlighten the lamp to get blessings of Lord Dhanvantari. I request intern Dr. Aishwarya Chiklikar for Dhanvantari Savan.
यो विश्वं विदधाति पाति सततं संहारयत्तेजसा सृष्ट्वा दिव्यमहौषधीश्च विविधा दूरीकरोत्यामया विभ्राम्नोऽञ्जलिना च कास्ति भुवने पीयूषपूर्णं घटम् तं धन्वन्तरिरूपमीशममलम् वन्दामहे श्रेयसे वन्दामहे श्रेयसे वन्दामहे श्रेयसे.
Thank you, Aishwarya. Thank you, all the dignitaries. Now I request Dr. Rutuja to proceed further session.
Thank you all. Now I request our head of our department, Dr. Dilip Katre sir, to welcome you all for today's webinar, SUPRAJA 2022.
Good morning to all. Myself, Dr. Dilip Katre, Professor in Prasuti Tantra and Shri Department, Annasaheb Dange, Ayurvedic Medical College, Ashta. I welcome and thankful to our inspiring founder of Sant Jnaneshwar Shikshan Sanstha and ex-minister of Maharashtra, Honorable Shri Annasaheb Dange, our respected Appa, who has given golden opportunity to us. I here heartily welcome our Secretary of Sant Jnaneshwar Shikshan Sanstha, Advocate Rajendra Dange, our respected Bhau. I also welcome Shri R.A. Kanai sir, Executive Director of Sant Jnaneshwar Shikshan Sanstha, Islampur. I am very much thankful and welcome Honorable Vice Chancellor of MUHS, Dr. Kanikar Madam, and respected Registrar of MUHS for giving us opportunity to conduct this knowledgeable event. I welcome Dr. Meera Bhide Madam, MUHS University Observer for the join. Now I welcome our principal sir and chairperson of today's event, Dr. Ashok Wali sir. Also, I heartily welcome our chief guest of today's webinar, SUPRAJA 2022, the eminent personality, Dr. Neeta Mahesekar madam, and today's guest speaker, Dr. Yogesh Joshi sir, and Dr. Gayathri Bhat madam. I welcome all teaching faculties, UG, PG students, and PhD students, all the participants. Our college has been virtually organizing various knowledgeable platforms in the form of research, workshop, guest lectures, and webinar to introduce the vast knowledge of Ayurveda in this pandemic also. Our Dhanvantari Hospital has given various opportunities to faculties and PG students for updating their skills. We have well-equipped OT, labor room, and Garbhasanskar center also. All Ayurvedic procedures and surgeries involved in obstetric and gynecology, like cesarean section, hysterectomy, and number of minor surgeries are very well conducted by our expert faculties and PG students. I can proudly say that recently our college has been accredited with NAC B+ grade, which is our great achievement. The aim of this webinar is to enhance the concept related to Ayurveda in the field of Prasuti Tantra and Shri. I hope our event SUPRAJA 2022 will definitely uplift your knowledge and skill. Thank you.
Thank you, sir. Now I request our organizing chairperson of webinar, Honorable Principal Dr. Ashok Wali sir, to say a few words for us.
Good morning. Good morning, all the delegates and the resource persons, especially also the units from the MHS Nashik. My dear friends, Sant Dhaneshwar Shikshan Samstha, Islampur, is reversed by the Honorable Shri Annasaheb Dange, ex-minister of the Maharashtra state, and also the secretary of this institute, that is Shri Chiman Babu Dange, alias Rajendra Dange. Sant Dhaneshwar Shikshan Samstha having 44 branches along with the Ayurved, pharmacy, engineering. Also, we have international English medium school, Anathashram, public school, etc., etc. Annasaheb Dange's Ayurved Medical College is affiliated to the, is approved by the NCISM and is approved, also affiliated with the MHS Nashik with the 100 intake. My dear friends, I am very happy to mention that this is the first Ayurveda college having a NAC affiliation with the B+, and also our college is ISO certified. My dear friends, we have 244 bedded Dhanvantari Hospital, and if I talk the Department of Prasuti Tantra and Shri, we have well-equipped department also with the well-experienced staff there in my department of the Prasuti Tantra and Shri. In a hospital, Dhanvantari Hospital, we have daily deliveries other than Caesar, and so many what we call that is the operative works, especially hysterectomy like this, they are doing well since 2020. So if I say that some of the major things of my department, especially Siro Prasuti Tantra, Garba Sanskar is very important. And each and every year we are going to do these functions with the Garba Sanskar like this. And my dear friends, so many eminent personalities are here to deliver their lectures. Hope that all the delegates will get some new approach, especially the subject related with the Sri Rog and Prasuti Tantra. And I hope you will get something new from this webinar. I once again welcome to all the delegates, all the eminent personalities from the state or the out of state like this. And I hope this webinar will be fruitful to you all. Thank you. Thank you very much.
Thank you, sir. Now I request our organizing secretary and associate professor of our department, Dr. Tinku Ganesh Khalche sir, to give brief introduction of today's webinar and to introduce our chief guest, Dr. Neeta Mahesekar ma'am.
Good morning all. Myself, Dr. Tinku Ganesh Khalche, Associate Professor, Sri Rog Department, and as well as Organizing Secretary. I welcome you all on the behalf of Team SUPRAJA 2022. The main idea behind organizing this webinar was to apply the practical knowledge of the experts from the field of Ayurveda in day-to-day life. Now I will give you a brief introduction and schedule of this webinar. The webinar has 3 sessions of 1 hour each. First 2 sessions are of expert speakers, while the last session is of paper presentation. Before this, we will introduce Dr. Neeta Mahesekar madam, which is our chief guest for this webinar. Madam is currently working as a director in Northeast Institute of Ayurveda and Homeopathy, Shillong, which is an autonomous organization of AYUSH. She has completed her BAMS from Hyderabad, where she has received Achanta Lakshmipati Gold Medal. Madam has completed her PG from Vijayawada and PhD from NHS Nashik. Madam has done PG Diploma in Clinical Research as well as Regulatory Affairs from the University of Birmingham. Madam has vast experience of 29 years in the field of Ayurveda and academy. Madam has chaired many committees and have got Lifetime Achievement Award from Ayush Darpan International Foundation in 2020. Now I request Dr. Neeta Mahesekar madam to share few words.
Namaskar to all. Good morning. I should be congratulating this college where I think I too contributed and I was part of this college. Before that, namaskar to all dignitaries, to the principal and Meera Bhide madam there. And before that, I should always be thankful to Annasaheb, whom we address as Appa and Bhau. Please accept my namaskar. Principal Ashok Waliji sir, please accept my namaskar. And good morning to all my participants here for today. And my co-speakers, I can say, Dr. Yogesh Joshi ji, Dr. Gayathri Bhat madam. And it is an excellent team, sir. I should say, Wali sir, it is an excellent team you have in Dr. Katre and his team. One of my associates from research is Dr. Anjali Upadhyay, and I'm saying my good morning to all my colleagues and the staff of Annasaheb Dange College, who I consider a very cultured, what I should say, where I felt at home. And thank you for giving me this opportunity. Initially, I would say this, and congratulations to SUPRAJA 2022. And it was really a great experience being in this college under every one of you. I think I had completed my PhD, and at that time, it was Annasaheb Dange College who had felicitated me for that. And I'm really thankful that I'm a part of your seminar here as a teacher, not as a chief guest, as you consider me, but I should say this, I'm a teacher simple. Here, I would like to say, SUPRAJA is getting renaissance in today's era with Rajashray. Ayurveda getting अच्छे दिन आ गए Ayurveda को भी, क्योंकि you all know it is only the Rajashray that matters. With COVID, we got something in blessing, we can say. This is a boon for us, and where we could project from the point of view of Ayurveda. Suprajanan definitely talks about Supraja. 20 years back, when I started my career in Aurangabad, CSMSS college, at that time we started with Garba Sanskar, Garbhasthapana, Dravyas and all. And we never used to go on with iron, calcium, antenatal protocol unless needed. So that time it was a point where people used to say, Madam, iron denge nahi, calcium nahi denge. I said 5,000 years back, if you go, our father's generation is more stronger, where our grandmothers never had any iron or calcium. We believe in Ayurveda, where Agni is important. Agni has to be, Agni is the source for metabolism, bioconversion of whatever ahar is taken, whatever vihar. So Ayurveda believes in dharma, artha, kama, moksha, wherein whole of, if you see the history, never Indians were invaders. They were always the people who wanted and opted for liberation. That is good living while you are living. That is hita ayu, sukha ayu, and for liberation, that is moksha. So for attaining moksha, your health should be good. Once your health has to be good, no compromise way of living, then the seeds have to be sown in the mother's womb along with the parents, both. So detoxification, Panchkarma is a part of it. Garbhasanskar, the Nasya, everything is a part where Charak Sanhita talks about Jati Sutriya Adhyay. See the language here. Jati is the progeny, the race, the Eugenics, which started in 28th century. The conception was in Charak Sanhita 5,000 years back. You know from Vedas, the Jati Sutriya. Sutriya, that is the Sutra, the chromosomes which carry the genes for the race, for the improvement of the race. And this is what he meant in Jati Sutriya Adhyay. If you go with Putreshti Yajna, Putra Ishti, that is whatever you feel like to obtain the progeny of your choice. And that was done by Dr. Dasharath Raja first time, which finds its note in Kashyap Samhita, wherein he says the yajna has to be performed with Vatagna Dravyas. Nowadays, again, with science going one step ahead with Vedas and Ayurveda, wherein now they are understanding the importance of not only the Aushadhi, but Daiva Vipashray, Satvavajay, Chikitsa also, which is an eternal part of Ayurveda. So wherein you go with yajna and the smoke, it is part of research now. If that is going to stimulate, the pituitary, the hormones for the better race for eugenics. So all these things you will be listening over the period now. To start with the eminent speakers who will be speaking later, but I see a big, vast research arena in this Suprajanan, in Supraja Chikitsa, where our people always opted for good race, good evolvement, good ayu, hita ayu, not only physical strength, but mental strength also. So I once again congratulate all of you and the whole team of Dange College. Thank you so much.
Thank you, madam. Thank you
Thank you, ma'am. Your words are really motivational for all of us. Now we are moving towards Now we are moving towards our first session. I request our organizing committee member and assistant professor, Dr. Saili Paste ma'am, to introduce our first guest speaker, Dr. Yogesh.
Thank you, Dr. Rutuja. Good morning, everyone, and welcome to the first session. I am Dr. Saili Paste, working as an assistant professor in Department of Prasuti Tantra Strok of ADMC Ashta. Now we will move towards our first session, practical implementation of Garbhasanskar and Beejsanskar in day-to-day life. Our first session resource person is Dr. Yogesh Joshi sir. Dr. Yogesh Joshi sir worked as a full-time worker for an NGO for 4 years. During this time of 8 years, he developed a practice in pure Ayurveda and successfully treated patients through Panchkarma and Ayurveda. Also established himself as a lifestyle management consultant. During this period, he also worked as a consultant in Lokmanya Holistic Cancer Care Unit. In 2011, he started his own AYUSHMAAN Ayurveda Panchkarma Center in Pimple Saudagar, Pune. Recently, he has started his own AYUSHMAAN Ayurveda Hospital. In 2010, he developed a unique module, Srujanankur of Garbhasanskar and Beejsanskar as a part of SUPRAJA Nirmiti. This module is the only module in the world which is structured and having consistency in conducting sessions since 2011. In 2012, he established a private co-limited companies through which he started conducting training programs and has trained 1,300 plus trainers throughout the globe. He is a pioneer in using online platform for this training. In 2019, Department of AYUSH appreciated his work and guided him to work with National Institute of Ayurveda, Jaipur. He has signed MOU with NIA Jaipur for standardization of Garbhasanskar and Beejsanskar process. Now I request Dr. Yogesh Joshi sir to deliver his lecture.
Good morning, all.
Good morning, sir.
My dignitaries of Annasaheb Dange College, Ayurved College, Ashta, Dr. Principal Dr. Wali sir, Dr. Meera Bhide madam, Dr. Neeta Mahesekar madam, today's chairperson. I am really thankful to all of the team to give me an opportunity to share my views regarding this SUPRAJA practice. This SUPRAJA is a very vast terminology. As Neeta Mahesekar madam has explained the importance of it, and all this practice was practically implemented in day-to-day practice many years ago. But by the by some things, all of this practice was concentrated on the delivery processes, ANC practice, Stri Rog, but a SUPRAJA was a very untouched practice. But now people are getting aware of this practice. People now their on themselves approach, and they are being educated through various platforms to get a healthy progeny. They nowadays, in this era, this SUPRAJA practice is a very important practice, because this practice is going to design the healthy progeny of our nation. So now people are approaching and they are expecting from Ayurveda practitioners that they need to have a guideline, a proper guidance to have their healthy progeny. So when we come to SUPRAJA, so what is SUPRAJA? To process, to develop a healthy progeny, what we call as eugenesis. And as we know that healthy male and healthy female gives birth to a healthy progeny. These are the basic concept on what we are working on. SUPRAJA includes Beejsanskar and Garbhasanskar. These are the two terminologies which are being.
Excuse me, sir.
Yes, ma'am.
Sir, please share your PPT presentation on full screen.
Yeah, 1 minute.
Thank you, sir.
Just give me a minute. Yeah, now is it visible? Yeah.
No, sir.
I have shared the full screen. Is it visible?
Full screen nahi hai. Still no full screen.
Sir, I have shared my full screen.
Sir,
Huh?
please share your full screen, then PPT.
Is it now okay?
Okay, sir.
Yeah. So SUPRAJA includes of two parts, the Beejsanskar part and a Garbhasanskar part. What is Beejsanskar? To prepare couple mentally and physically fit for a healthy present. It includes physical fitness and mind fitness. And what is Garbhasanskar? To prepare a mother mentally and physically fit for an uneventful and healthy progeny. It includes physical fitness, fitness of mind. It includes diet, yoga, lifestyle modification, live music therapy sessions. So we come to a need of SUPRAJA in present era. This is a very important thing. Why SUPRAJA is important in present era? Nuclear families, as we know, that most of the families are nuclear, small in today's era. So the people, the couple who gets or who wants to have or plan for a baby are not basically having a knowledge how to go for a proper pregnancy, how to plan a pregnancy. Most of the time what we see nowadays, it is the pregnancy by chance हो जाती है, हो गया pregnancy. And when all these things come forward and they face many problems in their day-to-day life, how to handle the pregnancy, what all things to be done, if they are planning for the pregnancy, what all things should be done, what all investigations are needed. According to Ayurveda, when they come to Ayurveda people for having the knowledge of or guidance of what they are planning, we need to guide them properly for a SUPRAJA. Late marriages, as we know, that the age of marriage is going late and late. So due to this, many of the things in their day-to-day life are being mismanaged. And after marriage also, the part of planning comes. अभी सेटल नहीं हुए हैं, देखेंगे, बाद में करेंगे. हमें एक दूसरे को समझना है. All these things come, and after late marriages also, planning part comes. And as the age is growing, we know that the dominancy of Vata dosh in the body starts increasing, and due to this, all the dhatus, doshas, upadhatus in the body are getting affected. So we need to organize their lifestyle also. The unorganized lifestyle is a very important aspect of today's need of SUPRAJA. कभी भी सोते हैं, कभी भी उठते हैं, कुछ भी खाते हैं, whatever they want to eat, whenever they want to sleep, they sleep. Any type of the combinations they eat. Because from the early ages, young ages, these people are out of their families, away from their families for many of the things, maybe for study, for their jobs, and even also, even though if they are living in their family, it is not that they are being guided for an healthy lifestyle. So all this leaves a very bad impact on their elements of the body, what we call dhatus. Because as we know, whatever they are going to eat, whatever is going to be digested, it is going to be converted into the dhatus and the strength of body is going to be created, and all the dhatus are going to be created. If the basic things are not being in a proper manner, obviously the further things are going to be produced in a very bad manner. So unorganized lifestyle is a very important aspect that we have to look upon. Increased stress levels. Because of this unorganized lifestyle, increased stress levels are there. Many of the times it is a self-induced stress. And from the ages of young ages, now people are facing stress levels, high stress levels, which leave a very bad impact on their mental stress. And as we know that mana is very closely related to the digestive system. Chintanam cha ati chintanat is the most important aspect or hetu for disturbance of रसधातु. रसधातु के दुष्ट लक्षणों में, कारणों में चिंतनाम च अति चिंतनात् ये एक प्रमुख लक्षण बताया गया है. So this increased stress levels also play a very important role in disturbing of on the hormones and their metabolic problems. So it leads to PCODs and many other hormonal problems, disturbances. So need of SUPRAJA is a very important aspect. Due to all these things, people lead to a low immunity in the couples. As we know that many of the times, most of the times, antibiotics, higher antibiotics are being given, prescribed to the couples, and most of the time all these antibiotics are not being taken in full dose, and further generation of higher antibiotics, broad spectrum antibiotics are being developed, and resistance is being created in the body for the antibiotics, which also creates a low immunity in the couples. Many of the times it is seen that people regularly take medicines for allergic problems, rhinitis, cold, cough, in which all the drugs which are being used, these are playing a role to suppress the things. So all the things are being suppressed in the body, all the doshas are being suppressed in the body, and need of SUPRAJA is developed in this era. So world is looking for a solution for all these things towards Ayurveda, and if we practice this in a very proper manner, then we are the only solution available on this universe for this healthy progeny, development of healthy progeny. When we look for the healthy progeny, samadosha samaganishya samadhatu malakriyaha prasanna atmendriya manaha swastha ityabhidiyate. This is a thing what we have learned from our first year, but implementation of this in our day-to-day practice we never do. When a person comes to us for a SUPRAJA, many of the times it is seen that कुछ नहीं है, हमको कुछ प्रॉब्लम नहीं है. All the investigations are being made, सब ठीक है, all are okay. But we need to develop the thing which a view in which we have to diagnose the proper aspect and what are the things. Are the doshas in sama sthiti? Is the Agni in sama sthiti? All the dhatus are is it that the dhatus are in very proper manner? So we need to know in our day-to-day practice that what are the proper aspects of all the doshas. Samadosha means what? Samagni means what? Dhatu, Samadhatu means what? So all धातुस उसकी पुष्टि अच्छी तरह से हो रही है या नहीं, सब दोष समस्थिति में है कि नहीं, अग्नि उनका ठीक है कि नहीं, और इन सभी का जो काम है वो हमें दो चीजों के ऊपर ध्यान देके हम बहुत बार इसे ओवरलुक कर देते हैं. The two things which give us a proper idea for indicating that their digestion is proper or not, that is the acidity, problem of acidity, amla pitta and mala pravrutti. So mala kriyas are very important and Agni is also very important in this. So most of the times कुछ नहीं है, ऐसा नहीं होता है. When we take the proper history of a person, they'll say नहीं कभी कभी एसिडिटी होती है, हमें सर्दी का बारंबार प्रॉब्लम होता है, मल प्रवृत्ति ठीक नहीं होती है. So these are the indications we overlook, but these are the very important aspects which are going to give you a proper hetu for further aspects of practicing of SUPRAJA and to make all these things, doshas in samasthiti, agni in samasthiti, dhatu in samasthiti. Maybe it not be that you will be able to make all the things in 100% in a proper manner, but to have in a very good manner 70%, 75%, 80% we can try for that. And along with all these things, prasanna atmendriya manaha, it is a very important aspect, because in pregnancy, as we know that सौमनस्कम गर्भधारणाम इज वेरी इंपॉर्टेंट. ये बहुत बार होता नहीं है, बहुत बार ये होता ही नहीं है, सौमनस्कम होता ही नहीं है. और प्रसन्न आत्मेंद्रिय मनाहा is very important. So to make all these things in a proper manner is a practice of SUPRAJA. We all know, I'll not go in details of this, factors essential for conception, Rutu, Kshetra, Ambu, Beej, but all these things are to be taken into be consideration when a person comes to you for a guidance of preconception for SUPRAJA. Practice of Rajasvalacharya in day-to-day life is very important. It has got a very important aspect in developing of further aspects of Rutu. Kshetra, this is also a very important aspect. We only see that sonography किया, क्षेत्र इज ओके, बट उसका बल अच्छा है क्या नहीं, उसके ऊपर किसी का असर हुआ है क्या नहीं. We never go into deep things of it, practice of it. And here we get the hetus of kshetra also, because as I said that the factor of late marriages is very important, and masturbation is a very important aspect in this part of kshetra, shaithilya, not only in male but also in females. Nowadays this is becoming very common. So here also the Shaithilya, part of Shaithilya, what is being said, we have to take into consideration the hetu of Shaithilya. Many of the times recurrent abortions are being seen because of this dhatu Shaithilya in the kshetra product. धारण शक्ति नहीं होती है. There are many aspects which are being not seen. Regular use of genes. This is a very important aspect. The people who come to my clinic, I say to them, if you are going to use genes till you are having a conception or you are having a baby, please don't come to me. Because not only in males, this genes has a very bad impact on the part of kshetra. As we know that use of genes.
Sorry to interrupt you, sir.
Yeah.
Sir, slide is not moving.
No, the slide is Rutu Kshetra Ambu Bij. The same slide.
No, sir.
Is it now?
So please reshare the slide.
Okay, now?
No, sir. SUPRAJA slide is there.
सर दूसरी स्लाइड दिसते है अजून.
Now? Now
Yes,
is it?
sir.
Yes, sir.
Yeah.
It's visible, sir.
Yeah. So the kshetra is part of what we are saying. I was saying the kshetra. Use of genes leaves a very bad impact on male. It is been also seen that many of the research papers have shown that regular use of genes and traveling long on the two-wheeler using the genes play a very important role in decreasing of the mortality and sperm count. Also in the females, this kshetra use of genes is leaving a very bad impact, because genes is a cloth which doesn't have any flow of air, and we know that vaginal part and other things are very hot in nature, and all this ushnata is to be percolated outside, which is to be gone outside. Many of the times it is percolated inside, which leaves a very bad impact on endometrium, vagina, cervix, ovaries, fallopian tubes. Most of the time the cause of fibroids, cysts, hemorrhages cysts, we don't find the cause. But if we take the history that how regularly genes is being used, and also that in the time of period of menstrual flow, you will find the factor here. You will see the hetu over here. So looking of these, correcting of these factors is very important. Ambu, as we know, it is a part of rasa dhatu. Unorganized lifestyle and other things play an important role in disturbance of rasa dhatu. We have to correct it, and at the end, bija. Uttama bija nirmiti is only possible if Ambu or Rasadhatu is in a very proper manner. So we have to take all these things into consideration. Six major components: Prithvi, Aap, Jal, Tej, Vayu, Akash and Atma. These are the 6 components of Garbha. The next important aspect, what we are never taking in consideration in the part of SUPRAJA, or that is in the part of preconception, or this Shadbhavs. We only have learned all these things in our practice, or not in practice, in our texts. But practice of this in our day-to-day life in SUPRAJA, we are never doing it. Our text has mentioned clearly which factors are to be transmitted from mother to baby, father to baby, Rasadhatu to baby. But only we say that ये hereditary है, hereditary है. All people are saying that hereditary, but we never try to find out the basic cause of these hereditary diseases. And our text has explained it in a clear manner, what elements are being going to transfer. And to be in a sad manner, we have never done any research on this. I would suggest there are the people of MUHS, AYUSH Institute, head of the departments, practicing all the things in Shri Roga and Prasuti Tantra. I would like to suggest that a proper research should be done in this aspect. So, Matruj Bhav, Pitruj Bhav, Rasaj Bhav, Satmaj Bhav, Satvaj Bhav and Atmaj Bhav. These are the very important aspects what we have to take in consideration during our taking history of the person. Whether mother is having the history, only we say, we have in our, we have learned, we have taken in our case papers, Matruj Kul, Pitruj Kul. We only mention, okay, diabetes is there, hypertension is there, cancer is there. But from where it has come? We never try to find out the origin of it. So we need to find out the origin of it as a part of Ayurveda things. So we have to take in consideration of these factors, and we have to plan our further processes of SUPRAJA during this practice. So I'll not go in details. All these things are being mentioned in our text. What are Matruj Bhav, all the soft elements of the body are being the contribution of the mother. The hard elements are being the contribution of the father. Atmaj Bhav, Satmaj Bhav, Rasaj Bhav, Satvaj Bhav. This also plays a very important role. I would like to elaborate some things on this. That mana is a connecting link between physiobiological body and a soul. It is not actually involved in the process of the conception, but if the connection is lost, if the link is broken or damaged, there will not be a new life or a normal growth, and development of Garbha will be in the danger. This is the importance of Satvaj Bhav. So, looking over the Manasik factors is a very important aspect. Many of the times we see that gestational stack is developed, but Atma is not been there. Many of the times anomalies are being seen. Many of the times unexplained abortions are there. So here we need to find out the cause, which mana is a very important aspect. Mana is not been involved in the part of conception, then all these things are going to be happening. So we need to find out the factor, most important factor, mana, whether it is involved in the process of Garbha or not, or having a stress level. Here this plays a very important role. So Beejsanskar, Ayurved Eugenics, what we follow in our day-to-day practice is to make a couple mentally and physically ready for the conception. It first needs Sharir Shodhan, then Manasik Shodhan, Rasayan, Vajikaran, Ahar, lifestyle modifications, and which results in the thing of Shuddha Shukra and Shuddha Shukra of both males and females. So Sharir Shodhan is a very important aspect. Choose an appropriate karma for the couple. It is not necessary that all the Panchakarmas should be done. Whichever necessary, Virechan, Basti, Nasya, these are to be practiced by default. Wherever needed, Vaman and Raktamokshan should be done. Allied practices, allied processes of this Shirodhara and Pindasved, Patarapindali Sved, Shalishashtik Pindasved, Patarapotali Sved, to correct the process of, or to correct the textures or the things of toning of the muscles can be implemented. Panchakarma should be done in a very proper and a very good format which is been explained in our text. Never go for shortcuts. Adhastha Sneha Darshanam, Rallas, and all the things of Snehana are very important. Snehapana are very important. Snehalakshan are very important. First Pachan, then Rukshan, then Snehan, and then a proper karma, and after that proper Sansarjan Kram is very important to be implemented in the practice of Supraja. If shortcuts are being created, you will not get the proper effect. And this Sharir Shodhan is to be done by both male and female, not only female or not only male. So benefits: to increase intestinal absorption, to enhance digestive system, to develop body elements, Panchakarma, diet, lifestyle modifications, Rayan science and modification, Vajikaran, Rasayans you can choose according to the hetus and the persons. Rasayan Churna, Amal ki Rasayan, Trifala Rasayan, Siddha Kshira, first and second month Kasaya, Mausan Mausik Kashay, Shatavari, Ashwagandha, Sariva, Kokshuradi Gugul. These are the rasayans what you can choose for after completion of Panchakarma. Vajikaran, Kauchapak, Makaradhwaj, Pushpatanva Ras, Vasant Kusumakar, Chakravallabh Ras, Garbhadharani Vasti, Suvarnamalini Vasant. This can be introduced or it can be used according to the requirement of the person. Mind detoxification is a very important process in the part of Supraja, as a part of preconception. Meditative processes, avartan dhyan, chakra shuddhi, stress relieving activities, importance of Ashtanga yoga as a part of yam niyam and achar rasayan. These are very important aspects. This mental detoxification is very important because, as I said, that the importance, because of late marriages, many of the things are being in the mind, saturated in the mind from long time. Many of the times all these things are not being shared, and this plays an very bad impact, leaves a very bad impact on the process of mana, and also the stress factors increasing in the day-to-day life also leave a very bad impact in mental process. So all these things should be planned in a very proper manner. Lifestyle management, diet management, exercise, sleep, brahmacharya should be taken care of. So Beejsanskar program, what we practice, it is of minimum 4 to 5 months. Prakriti parikshan of a couple, history taking of a couple, to counsel couple regarding to Eugenics program, to mark out the unhealthy factors which may affect the production of the healthy progeny, to start with dosha pacha treatment, advise a healthy lifestyle for the couple which will be based on ahar, nidra, vyayam and brahmacharya, sharir shodhan by Panchkarma process, manasik shodhan by meditation process, stabilizing of body elements by rasayana, bija shuddhi and virya vruddhi processes by vajikarana treatment. So this is a complete program what is to be practiced in your day-to-day practice for a part of SUPRAJA, in a part of Beejsanskar. All this, if it needs a proper explanation, every aspect. So who can plan for a Beejsanskar? Every person who is planning for a baby should undergo the process of Beejsanskar. Not only the people who are having the treatment of infertility, IUI, IVF, but these also should take. But the people who are planning for the baby, the persons who are intending for a baby should undergo the process of Beejsanskar. We are the doctors, but we know all these things. We ourselves never practice this. So first of all, we ourselves should start practicing, start propagating this. Then only people are going to get aware of all these things. After conception, the process of Garbhasanskar comes. SUPRAJA, the second part of SUPRAJA is Garbhasanskar. So sanskaro hi gunantar dhanam. Sanskar means to replace bad qualities by good ones. Here we are going to make good and positive transformation. You are seeing a stone and a idol. The things are little mismatched in the side, but to get the concept, this is a concept based on what Garbhasanskar process is that. What is the Garbhasanskar process? We explain this process to the people in the way that an artist who is performing or who is making an idol, does he makes the idol in one day? No. So what he does is the same process of Garbhasanskar and Beejsanskar. He first of all chooses a stone on which he has to perform, or from which he has to perform an idol. Then he makes perfect in his mind that what he has to make. Then he takes a continuous effect. He regularly devotes time for making of this sculpt of stone to the idol. ये कंटिन्यूस प्रोसेस है, एक दिन में नहीं होता है. उसको सातत्य करने की जरूरत है. तो अगर ये और ये जब मूर्ति सबके सामने आती है, when this idol comes in front of all the people, we praise and say, यह क्या अच्छी मूर्ति है। बुरी मूर्तियां भी होती है, लेकिन यहाँ हम अच्छी मूर्तियों का ही विचार करेंगे, क्योंकि हमें अच्छे गुणों का ही विकास करना है। तो कितनी अच्छी मूर्ति है, कितने अच्छे भाव है उसके मुंह पे ऊपर, कितने अच्छे भाव उसकी आंखों से छलकते हैं, कितना अच्छा टेक्सचर है। हम कहीं से भी देखते हैं तो हमारी तरफ देख के ही वो मुस्कुराती है और हमें प्रसन्नता निर्माण होती है, ऐसा हमें प्रतीत होता है। तो अगर ये मूर्तिकार किसी निर्जीव पत्थर में अपने मन के भाव अभिव्यक्त कर सकता है, तो क्यों नहीं, अगर वो माता पिता अगर चाहे तो सातत्य से और हमारी गाइडेंस से अपने मन के भाव उसमें क्यों नहीं अभिव्यक्त कर सकता। इस बेस के ऊपर ये गर्भ संस्कार की प्रोसेस है। What should Garbha Sanskar include? Counseling, diet during pregnancy, do's and don'ts according to Ayurveda, yoga during pregnancy, meditation, mind training session, music therapy, mantra, group discussion sessions. In this thing, people regularly practice yoga. काउंसलिंग भी होती है, डाइट भी बोलते हैं। But Garbha Sanskar practice is totally different from ANC practice. The people who are practicing ANC can practice Garbha Sanskar, but the person who are practicing Garbha Sanskar, it is not necessary that they will be practicing ANC practice. I don't practice ANC practice. मैं किसी भी I don't treat any pregnant woman, उसका कोई भी एलिमेंट हो, until and unless I get a consent from the treating gynecologist, I don't treat the person. हमारे यहाँ in our text most of the things are being explained that आहार ही औषध है. Diet during the pregnancy is the medicine for the pregnancy. It is a natural process. Until and unless there is a very problem, which is creating a problem, we need to treat it, which is going to play an impact on the baby and the mother. We need to treat it. So these are very important aspects, that diet is a medicine in pregnancy. So proper management of diet is very important, because as we know, whatever the lady is going to eat, which is going to be digested, that is going to absorb from the intestine, and it is going to nourish the baby and also the mother. Nothing is going to come from outside. So we need to take a proper and strict formation of diet during pregnancy. Mind training session is a very important aspect, because as we know that both the mind of the mother and baby are very near to each other and leaves an impact on each other. So it is been explained the part of Dauradhya also. Here we see the impact of baby's mana on the mothers. Eventually the mother is also going to play an important, mother's mind is also going to play an important role in developing of baby's mind. And here we need to help her, guide her to be in a happy state of mind for whole 9 months. We should, in our Garbhasanskar program, we should always see that she remains in a happy state of mind for all 9 months. So all the things which you are planning in Garbhasanskar sessions, should be in a part of these things to play and to have to shape the mother's mind to be in a happy state of mind, to reduce the stress in her day-to-day life, to enjoy the every moment of her pregnancy. So these Garbhasanskar centers should be a parallel centers where they should get the environment of their family, a good friends, good counseling, good guidance during of diet, of yoga, of stress leveling activities, to be in a happy state of mind, to learn and to help them to be in a happy state of mind. We have developed two or three modules of this mind training session, which we have seen a very important, means very good effect on this pregnant woman. And all the sessions should be interactive sessions, active and passive. It should not be only passive. If it is the sessions are being passive, the ladies will become bored. And it should be a continuous process. महीने में 2-3 बार 2-3 दिन का सेशन लिया नहीं होगा, पूरे 9 महीने में 2-3 महीने का सेशन, पूरे 9 महीने में एक सेशन लिया, 5 दिन का 4 दिन का सेशन लिया फॉर प्रेग्नेंट वुमन और छोड़ दिया घर में, करो आपको जो करना है. It is not expected. The continuous sessions should be conducted. They should be in your touch. Every week twice they should come to your center to have these sessions. So structured sessions should be conducted for these pregnant women, so they are in your touch for all the 9 months. What we have the schedule of our Garbhasanskar program, 8 sessions in a month, 4 Garbhasanskar sessions, 2 yoga sessions, 2 live music therapy sessions. Along with this, we conduct some group discussion sessions, diet sessions, and other activities for the pregnant woman. And the lady joins at our center. Whenever she joins from 12th week, she is there with us till 38th, 39th week, or the one day before the delivery. Also, many of the pregnant women have attended it. Fixed schedule of meditative sessions, music therapy sessions, yoga sessions should be there. Dedicated time, marketing and research is very important aspect. It is not like a day-to-day practice. आज मैं नहीं हूँ, कल आ जाइए. आज मैं नहीं हूँ, 7 दिन की दवा लेके आ जाइए. It is not. You have to plan a very structured module of the Garbhasanskar sessions, what we are practicing it from our last 10 years. And I am proud to say that from last 10 years, we have not missed a single session on Saturdays, on Sundays for pregnant women. Some data analysis of the Srujanankur module, what we are practicing, what I showed the schedule of, I'll present in front of you. This data analysis was made around about 5 years back. A preliminary analysis of participants. Out of 363 participants, data of 215 participants who had attended the program for minimum 3 months is taken into consideration for analysis. The data was collected. After each session, we have made a questionnaire for each session, and we are used to take the feedback of these pregnant women after the session. All sessions were well accepted with excellent safety profile. The analysis reflects 29 variables and 26 components of body, 12 of body and 17 of mind. Mother specific variables were 23 and fetus specific variables were 6. Effects are proportionally to the adherence to the session. So, points of observation in Garbhasanskar session: level of stress, concentration in work, level of acceptance, anxiety, depression, fear, mind stability, feeling of happiness, understanding of good values, stabilizing in breathing rhythm, increasing positive thinking and sound sleep. These points were observed and these were noted during the after each session of Garbhasanskar. Effect of session: out of 215 participants, 97% results were reported in anxiety, mind stability, positive thinking and sound sleep. Improvement in other dimensions were reported by all 100%. Points of session of music therapy. This music therapy session is a very unique session what we conduct. It is a very live session in which the vocalist sits in front of a pregnant woman and performs a scheduled structured program for pregnant women, in which these are having an active and passive participation. My wife, Dr. Mrinalini, also she is a BMS Ayurved doc consultant. She is also a classical music student. She conducts this session regularly. So, level of stress, response of baby listening classical music, response of baby in active participation in music therapy, liked active participation, response of baby for overall music therapy session, response of baby during live instrumental music. Many of the times, twice in a month, once in a 2 months, we play santoor, flute, ya sitar. For this live sessions are being arranged for pregnant women. Effect of music therapy session: stability in breathing rhythm, feeling of happiness, anxiety, awareness in breathing. Sorry. Effect of music therapy: out of 215 participants, 95% of them reported an effect of breathing and baby effect on breathing of baby. 98% of them reported breathing stability, positive effect of music therapy. Improvement in other dimensions of music effects were reported 100%. Points of things in yoga session: back problems, muscle strengthening and toning, joint problems, flexibility of abdominal muscles, work stress and postural flexibility. Out of 215 participants, back problems and muscle strengths were improved in all of them. Improvement in other problems were 97 to 98%. So this is a data analysis which we have made and of our whole music therapy or Garbhasanskar program. The data analysis was made and we were happy to see the things. We have also collected around about 70 plus video feedbacks of the pregnant women after their delivery and during their pregnancy process, that you can see all the things in my YouTube channel. So these are the aspects what we are practicing in our day-to-day practice. A proper structured module of Beejsanskar and a proper structured module of Garbhasanskar are being practiced in our day-to-day life. This is a we have short time, so I have tried to cover all the aspects what we are practicing in our day-to-day practice. each of the aspects needs more than 4 to 5 hours for special elaboration of all these things. I once again thank the organizing committee, the Department of Prasuti Tantra and Shri to give me an opportunity to share my views and my practice in SUPRAJA, in day-to-day practice, what we are practicing. If the organizers would like to have some question hour sessions, the session is open for discussion.
Any question regarding this session? Sir, there is one question in chat box.
Yeah, I'll see.
What is importance of Suvarna Prashan?
Suvarna Prashan is a thing which develops the good elements in the baby and to develop the immunity in the baby. Many of the times this Suvarna Prashan also we the ladies or who are our own patients and who ask with the consent of a gynecologist, we ask them to have this Suvarna Prashan in 6th month, which helps in development of mana during the pregnancy. I never practice this part of Suvarna Prashan only on Pushya Nakshatra. I practice, this is the part of my practice, that I ask the lady to give the doses of the Suvarna Prashan regularly for 6 months, and after that, for those who are willing to have twice a month, I ask them to have this Suvarna Prashan, because I have not find any reference of Suvarna Prashan only on Pushya Nakshatra in any text of Ayurveda. So I practice the part of Lehan which is been explained in Kashyap Samhita. This is my point of view regarding the Suvarna Prashan.
So there is another question in chat box. Before how many days of conception the Shodhan should be carried out?
Yeah. The Shodhan should be carried out minimum 3 months prior, 3 to 4 months prior to the say of conception.
So another question is there. From which month we start metallic preparation on in ANC and why?
I didn't get this question. Metallic preparation means what?
Sir, can we use Rasakalpa?
Wherever it is necessary, you can use Rasaushadhi from first month of pregnancy also, wherever necessary. As part of many of the times hyperemesis is seen, and hyperemesis is most of the times it is seen part of Amla Pitta. So here we use Dhatri Loha, we use Swarna Soothshekar, which gives an excellent result. Listen, assessment of hormonal points is a very important thing, because we should know the part which hormones are being disturbed, and we should assess not only the hormone study. I never write in my case paper that low MH level, low prolactin level. I never write in my case paper. I try to find out the reason behind that, and I try to write down the Ayurvedic terminology or hetu for these things and the terminology for this hormonal imbalance. And basically these hormonal imbalances are due to the avrodh and improper वे ऑफ प्रैक्टिसिंग और इम्प्रॉपर, मतलब ये जो हार्मोन्स है ये हमारे शरीर का जो प्राणवायु है, प्राणवायु और प्राण शक्ति का जो चलन वलन है, प्राणवायु का जो काम है वो ठीक नहीं होने की वजह से बहुत बार ये हार्मोनल इम्बैलेंस होता है. सो ट्राई टू कोरिलेट दिस थिंग्स अकॉर्डिंग टू द pranavayu and pranavayu vata dosha. You will find a answer in it. But assessment in today's practice of hormones is very important, but you should be able to analyze it in the form of part of Ayurveda.
Thank you, sir.
Excuse me, sir.
Yeah.
Yeah, in the first Prakash, we got that use of Shashti Shali is beneficial in this particular phase. But now we don't, Shashti Shali is not easily available. So, we use a substitute of that Shashti Shali. Many people don't know what is Shashti Shali Chava.
For this we need to have a proper means we have a proper source of Shashtik Shali, and we during all of the ANC period we always ask the people to have Shashti Shali rice from the sources. You have to
In Maharashtra, we have Shashti Shali Chava.
pardon.
In Maharashtra, we have Shashti Shali Chava.
Yeah, we get from some people or some sources, we get it. We have to rely on them, but it shows good results in it.
Okay, sir. Thank you.
But for the people, you have to arrange it if you want them to have a good proper result. If you want to have, you should arrange for your patients. Just like what we say that देसी गाय का दूध लेना चाहिए, तो देसी गाय का दूध का सोर्स सभी के पास होता है ऐसा नहीं है, तो हमको वो ढूंढना पड़ेगा और उनके लिए अरेंज करना पड़ेगा. आप अपने यहाँ रखो या उनको बोलो कि यहाँ से लो.
Thank you, sir.
Thank you, sir.
For all these things we should take the efforts, because we are the people who are going to initiate the things. We want to have our further generation to be in a very good healthy progeny, and only Ayurveda has got the solution for this. No other part has got the healthy solution for this. So if we want to have good results, we have to arrange for all these things, sources, and we have to provide them. Yeah, Any more? How much should you have to consider low testosterone level in female who are willing to conception? If it is playing an important role or if it is affecting the conception, try to find out the reason why this testosterone is low. Try to find out Ayurveda things, because what I said to you, that all things are being prepared in our body through our aharasa. Something there is a problem in rasadhatu, something there is a problem in ambu. So rasava srotasa dushti is very important to be seen in all these things. Treat rasava srotasa dushti, try to give rasa and vajikarna treatments, you will find good results in testosterone.
Thank you, sir. Thank you, sir, for your valuable guidance. This was really a fruitful session for all the Ayurvedic practitioner and students. Heading towards our second session, I request our organizing committee member, assistant professor of a department, Dr. Nisha Panadkar ma'am, to introduce our second guest speaker, Dr. Gayathri Bhat ma'am.
Thank you, Dr. Rutuja. Good morning, everyone, and welcome to our second session. I am Dr. Nisha Panhalkar, working as assistant professor in Department of Prasuti Tantra Shri of Annasaheb Dange Ayurved Medical College, Ashta. Now we will move towards our second session, management of minor element in pregnancy through Ayurveda. Our second session's resource person is Dr. Gayathri Bhat ma'am. Ma'am is working as a professor and head of department of Prasuti Tantra एवं Shri in SDM College of Ayurveda and Hospital Hassan, Karnataka. She having clinical experience of 26 years in reproductive health and teaching experience of 20 years in Prasuti Tantra Shri department. She worked as an academic visitor at Ayurvedic University Europe, UK, and also as a faculty in a training program of student of Ayurvedic University Europe, UK, and Middlesex University, UK. She had presented 15 papers in national and international seminars and CMEs, and having 25 publications. She was chief consultant in a free health camp held at Indian Embassy in UK. Ma'am has conducted training program for AYUSH nurses under NRHM. Ma'am had participated as a resource person in Ayurvedic sensitization training program for allopathic medical officers sponsored by NRHM. She was chaired a session in 33rd Annual Conference of Indian Association of Biomedical Scientists, International Symposium on Recent Trends and Advance in Biomedical Research, and also chaired the session as a resource person in international seminar at Global Wellness Met from 26 to 20 February 2016 held at Bangalore, India. Ma'am also a research person on Madhu Samvad on 17 to 18 March 2017 organized by All India Institute of Ayurveda, New Delhi. Ma'am are organizing secretary of Prajata 2014 National Seminar on Postnatal Care and Suvidha 2018 State Level Workshop on SOP of Sthanik Chikitsa. She had attended many teletalks and radio talks. Ma'am is awarded by Akshara Abhishek and Bishak in 2015 and Doctor of the Year in 2018. So I request Dr. Gayathri Bhat ma'am to deliver her lecture. Welcome, ma'am.
Due to some technical problems, ma'am will join us with short time. Welcome, ma'am.
Yeah, thank you. Hello.
Yes, ma'am.
Yeah.
You're audible, ma'am.
Yeah. Shall I start? I could not. I was not there all for 5 minutes.
No problem, ma'am. Start your session, ma'am.
Okay. Good afternoon. I thank the organizer for giving me this opportunity. And the topic given is, it looks very simple, that the management of minor ailments of pregnancy through Ayurveda. But when, as a practitioner, we know that when the patient is in front of us, when a pregnant lady is in front of us with this kind of ailments, it's to decide the treatment modalities. for the drugs, it's a little bit tricky for us whether to write the medicines, what to write, what not to write, for how many days the dose, and all these things will be there. That too for new practitioners, it's very difficult for them to decide the treatment for minor ailments. So, to begin with, we all know that pregnancy for all women, it's very exciting, and it gives very joy when she comes to know that she is pregnant. And it is the state, or it is the condition where also she gets more, she will be more anxious, and she thinks that she is giving she giving accommodation for some new being, and she should be times the atmosphere or the place where she lives may not be that much the favorable for her. And am I audible?
Yes, ma'am.
Am I audible? Unstable connection. Hello.
Yes, ma'am.
Yes. Yeah. So due to anxiety and all,
Hello, ma'am. Ma'am, you are not audible now. Hello, ma'am.
hello. Yeah,
Yes,
that's
ma'am,
a
you can.
connection. Because I have opened now, people are just calling. Yeah. Okay. So, and all of us know that pregnancy is a state where there will be progress
Hello, ma'am. Ma'am, please unmute your mic.
Now, yeah,
Yes, ma'am.
can you? Yeah, okay. Next, please, Siddhartha. Okay, so Kashyapa, and because of all the Tridoshas unstable and Saptadhatus are unstable, during pregnancy there are many, the physiological and anatomical changes for which there are some symptoms the pregnant lady gets. And also we know that the fetus is like a foreign body. When any foreign body enters our body, there will be immune responses, and the body try to reject the content. So because of this also there will be problem in the pregnant ladies. For this Kashyapa in Antarvarti Chikitsadhyana Kilastana, he says that Jwaradhyanam Vikaranam Yatra Yatreha Lakshanam Annadanam Pravakshami Tagnyayam Garbhinishvapi. That means the Annada. That means the Annada, the whatever the diseases, Jwara, etc., Jwara, Atisara, Pandu, Prameya, whatever the diseases the the Annada gets, same the Garbhini lady also will get, but the treatment only differs. It should be Sukshma Kriya. So that means pregnant, though she is the special conditions she is having, but still other diseases what non-pregnant lady gets, she also chances of getting those ailments are very common. So, in specifically to understand or to discuss with the ailments during pregnancy, it is all considered under Garbhopadravas in Harita Samhita. So, Shosha Hullasa Chardishta, Chofo Jarastata Aruchihi, Atisaro Vairanatam, Ashto Garbhasya Upadrava. So, this word only says that Garbhasya Upadrava, because the Garbha is inside her body, she is getting these ailments. There are Shosha, Rillasa, Chardi, Shofa, Jwara, Aruchi, Atisara, and Vaivanya. So apart from this, there are many other, the ailments also will be seen in a pregnant lady in different trimesters. So have tried to, mention here according to the trimester. So in first trimester, there will be morning sickness, nausea, vomiting, hyperemesis gravidarum, garbhini, that is rillasa, chardi and all, and constipation also very common, that is garbhini vibandha, mutra vikaras or maybe frequent urination or urinary tract infection, burning micturition, painful micturition, low back pain and lower abdomen pain during micturition, and headache of different magnitude, tender and swollen breasts, Kanashula, and in the second trimester. So many a times the morning sickness or such the symptoms may be revealed. Relieved by second trimester, and there will be because of the stretched abdomen, there will be stretch marks or the the called as the linea nigra as well as the stretch gravidarum, which is referred as Pikisa, and there will be hyperpigmentation all over the body most of the time on the face, that is the chloasma or the Vaivarnyata we can take, and very commonly the pregnant lady gets the will be the by second trimester she will be diagnosed with anemia, she will be having palpitation and the what you call palpitation and generalized weakness. So it can be considered as a PAND. And the third trimester, once again, the frequent urination will be once again will be seen, maybe urinary tract infection or the just a symptom of pregnancy. And there will be pada shotas, unilateral or bilateral, and very common painful hemorrhoids also will be said associated with the constipation. And once again, the tender breast, something the leaking colostrum also will be there during the third trimester. Along with that, there will be Udarashula, which is very common, Kasa, Shwasa, Pratishaya, Dantashula, and Network. So, I mean, our acharyas have given guidelines for the treatment of a pregnant lady. What they say is, can you hear me?
Yes, ma'am.
Yes, ma'am.
Garbhini Tikshna Ushada Vyavaya Vyayama Vardhaniya. Tikshna Ushada. So, Garbhini, whenever we are treating, we should keep in mind about the Garbhopaghatakara bhavas. Not maybe the treatment, Aushadis also should not be Tikshna. And Kashyapa he said that Vyadishchasya Mrudu Madhura Shishira Sukam Sukumara Prayahi. So, Mrudu, Chikisa should be Mrudu and Madhura Praya. Katu Ushna, Tikshna, Katutikta Kashaya type of medicine should not be used. It should be, and any treatment modalities, procedure we are using, that should be Mrudu, and Shayana, Asana, Astharana, everything should be Mrudu, and Madhura and Shishira Praya. The diet and the drugs also should be having Madhura Rasa and Shita Virya. And it should not trouble the pregnant lady as well as the fetus. Hence, it should be Sukha treatment as well as Sukumara Praya. So, Aushada, Ahara, Upachara. So, all these things should be Mrudu, Madhura, Shishira and Sukha. Then only it will protect the pregnant lady as well as the growing fetus, and it will treat her ailments, problems. So, clinically speaking, the treatment protocol should include the Nidana Parivarjana. So, whenever she has come for antenatal checkup, we should tell them do and don'ts. So, do and don'ts very important. We just not only the examination, the fetus will grow without examination also. But the thing is, the antenatal care is meant for supervision, education, and then the treatment. So, we have to supervise her daily routine, her diet, and all. And wherever needed, we need to modify her diet and lifestyle. And we have to make them understand the importance of do and don'ts. So, by Nidana Parivarjana, if she is taking and then the Garbhopaghatakara bhavas like Tikshna Aushada, or the like आता रहता है क्या कर सकते हैं? Hello.
Yes, ma'am.
Yeah. Today is my OPD day, so that's very rush. So people keep calling, not
It's
able
okay,
to.
ma'am.
That's why the disconnection happens. So Nidana Parivarjana, it's very much important. Then when we plan for any treatment, Dravya Bhuta and Adravya Bhuta treatment we plan, and as much as possible, because it's a pregnant state, Adravya Bhuta Chikitsa is always helpful. So there actually counseling should be given. So then only that most of the problems like early pregnancy, that anxiety, Shirashula, Stanashula, and that vomiting, harlasa, aruchi, such type of problems, most of the such problems will be solved by counseling and diet and lifestyle modification. And if at all with this also, if our problem is not solved, then we have to treat with the Dravya Bhuta. We have to switch on to Dravya Bhuta Chikitsa and the drugs which are the planned on the should be on the base on dosha bala and the rogi bala, and according even the aushadha also should be given according to the matra and according to the trimester and according to the roga bala. So Acharya Kashapa, but always he stressed that aharohi mahabheshaja. So ahara can cause the health problems as well as ahara can treat. So many patyas can be used as a aushadha during pregnancy. And as all of you, we know that due to the medical legal problems, we always plan not to prescribe any medication during pregnancy. As much as possible, with diet only, we want to cure the problem. So coming to Vishesha Chikitsa, what I have discussed so far is the Chikitsa, the Siddhanta treatment principles. Then coming to Chikitsa, Vishesha Chikitsa to the different ailments. As I said, morning sickness, all of us know that it's a simple vomiting during pregnancy. Early till 12 weeks, it will be there. Most of the time when we change her place, because by moral support, and by changing her place, the 60 to 80% of this type of problem will be solved. Otherwise, if it is not solved, it become hyperemesis, and which may be dangerous for her life as well as the fetal life. So, as this simple the vomiting or this morning sickness type of problems can be solved by just day-to-day activities. So suddenly she should not get up from the bed. She has to, when she wakes up, she has to do mild exercise on the bed itself, and she has to take 10 to 15 minutes to get up from the bed, and and before brushing, she has to take some dry rusk or some biscuits or some yavagu or the just peya. And I always tell them to just wash her, the gargle with the hot water. Then only after 10 to 11 o'clock, she can brush. Because early pregnancy brushing only stimulate the vomiting. And if it is not the helpful, then we can give her Bhunimba Kalka with Sita, which is very well helpful in our daily practice. And we can ask her to take Yava Saktu with the Shunti Kashaya or Dhanyaka with Tandulodaka. But Dhanyaka Kalka, if it is mixed with Tandulodaka and taken, sometimes that coarse powder may, coarse particles may stimulate in the throat. So better she prepare Dhanyaka Hima, and that taken with the Sita, that will be helpful. That too by the drip, sip by sip she has to take whole day. And in that Dhanyaka Hima only she can add lemon, one or two, for 1 liter at least one lemon lemon and two or pinch of shunti powder and pinch of ela powder, and that can be stored in a copper bottle or the silver vessel, and that can be taken sip by sip throughout the day. So it is Deepaka Pachaka, as well it is Ruchi also, and also that it helps in maintaining the hydration. So, and another beautiful drug which is very commonly used are Dadima Swarasa. Usually people have a habit of taking Dadima fruit itself, but the Dadima seed is Vatakara, hence it may cause the Vibandha, and so better to avoid. So ask your patient to take Dadima Swarasa, and that too with the Laja, with the Laja Manda, Dadima Swarasa is mixed and taken. That will be helpful not only for the early vomiting, also it helps in fetal growth, because it is what you call Brahmana, and it is Rakta Prasadaka. So it prevents Garbhini Pandu in the future days. And in Dauhadavastha, we know that her whatever Ikshita, whatever the things she likes, that should be given to her, whatever article she likes, that should be given to her, and we have to keep her mind very calm. So much Somanasyam Garbhadharanam. So her attender or the husbands and the family members should be careful while talking to her, and they should take care of Priya Bhartaha, they said. So they should take care of her, and the most of the time that type of early morning whatever morning sickness type of symptoms will be relieved by giving moral support. That then another symptoms will be is frequent urination, or the type So Gokshura Kwata, after 13 weeks, we can do Gokshura Kwata 50 ml BD after food, and Punarnama Sarasa or the Punarnama Kwata 50 ml BD after food. In our practice also, before 12 weeks, we are not prescribing any medication. Medication. Then for stretch marks, that is Kikkisa. So it is also one of the Garbha Upadravas. So we know that it cannot be prevented, but the symptoms like burning and itching on the abdomen, thighs, and sometimes even all over the body, or maybe on the face also, breast also, such marking will be there, which will be very itching. And we always tell them to take Chandana and Ushira Lepa, apply, or Manjishtadi Taila all over the body, or Kshirabala Taila application, Abhyanga, and taking Sukoshna Jala Snana. And if it is too much, then Shirishadi Taila application before and after bath will be helpful. Chandanadi Taila and or Chandana Churna along with the Navanita, that also can be applied all over the abdomen, or that wherever the Kikkisa is there, and it will be helpful. But usually pregnant lady think that the discoloration will be completely cured, but we should to convince them or the counsel them that it is going to be there forever. And another this aloe vera gel, which is available in the market also, but fresh aloe vera pulp can be taken, and with the haridra churna that also can be applied. That also will be helpful. Or plain aloe vera also gel can also be will be helpful. Then on the face, Vaivarnyata will be there, that is chloasma, also melasma, and we know that it is not going to harm harm the pregnant lady or maybe the fetus, and it's just a sign of the changes in the body, but it because it's a cosmetic concern. So Kunkumadi Taila Mukhabhyanga, Chandanadi Taila Mukhabhyanga can be done, and along with the Chandana, Manjishta, Lodra and Haridra Lepa or Vacha Lepa can be done on the face. But I have seen most of the time, 99%, this kind of problem will be relieved only after the delivery, after 5 to 6 months, 10 months of a postnatal period. Then a very common problem with pregnant ladies, Garbhini Vibandha. So we know that it is due to the progesterone, increased progesterone level. And as I said, during pregnancy, Vata always will be in Prabalavastha. So Vata, due to that, there will be Rukshata in the body and there will be Vibandha. And also pregnant lady, because of nausea, vomiting, will not be able to take proper diet. Because of that also there will be constipation. So, but this constipation will be, we may lead to Garbhini Arsha, hence it should be treated. But laxative, modern people, they give milk of magnesia, and what we can do is, the early pregnancy, once again we have to tell them to avoid the drugs, and with the milk and milk products only she has to take, so that it decreases the rukshata and increases the bulk of the stool. And also we have to encourage her to take fiber rich food, and take hot water with the ghrita, milk with the ghrita, like that. And after later months of pregnancy, we can ask her to take Triphala Kwata mixed with Haritaki Churna, or Ayurveda Taila should not be given, because we know that Ayurveda Taila initiates the labor, onset of labor, so it should not be taken. And in Garbhini Chikitsa, Tadarthakari Chikitsa is told. So if it is very chronic Vibandha, 4 to 5 days, the problem constipation is there, and we know that before 8th month, enema is contraindicated. We should not give the basti. Only after 8th month basti treatment can be given for the Purana Mala Shodhana. Before that, if with the Shamanaushadhi is also not by giving Anulomana, by giving Rechaka medicine also, if it is not helpful, then Phalavartis can be helpful. Then for Mukapaka, usually due to the ushnata of the pregnant state, there will be the Mukapaka. So the Gandusha with the Haridra and Ghrita, Haridra churna in the water should mix, and in hot water, then Ghrita should mix and Gandusha should be given, and or Lodra Kashaya, Gandusha can be given. That by that also it will be helpful. And we can also tell them to take the chutney made out of kakamachi, which will be helpful in relieving the Mukapaka. Then if it is not available kakamachi, that irimedadi taila, oil pulling can be also done in Mukapaka. Then very common that too nowadays, the corona time, so Shwasa and Kasa, and body ache, pratishaya, this type of problem they are coming. So we can ask them to take Guda with Rashta Churna and Draksha and Haridra. Like Draksha Kashaya can be given, and Haridra, Shunti Haridra powder can be mixed with milk, and that should be boiled and taken. Or Haridra Khanda with hot water also can be given. And Tulsi Swarasa, Lashuna, Kshirapaka, all those things may be helpful in relieving the Kasa. And for Chwasa actually, Lavana Taila, Uro Abhyanga, can be given, and with the hot water fermentation, that also will be helpful in relieving the bronchitis. Then for Pratishaya, Esti Madhu with the Shaudra or the Madhu also will be helpful. And most of the time, if it is too much, the problematic with our medication also not helpful, and where we also ask them to switch on to the modern medication. And then coming to headache, it's a very common complaint, but having the cause etiology, different etiology, there may be due to the headache, maybe due to nutritional deficiency, which may be caused leading to the anemia, the anemia causing the headache, maybe due to nausea, vomiting, not proper taking proper diet, or the liquid intake, or that also may be causing that dehydration, may be causing the headache. And suddenly we ask them to not to take coffee and tea. So because of that withdrawal syndrome also there may be headache, and low blood sugar level also cause headache, and high blood sugar, high blood, the high blood pressure. So that may be the many cause for this headache and different trimester. So whatever may be the cause, that cause should be treated first. Sometimes if it is, we have to encourage them to take plenty of liquids, and Rasna Lepa on the head, we ask them, and Sirobhyanga with Himasagara Taila, Jyotishmati Taila, or maybe Kshirabala Taila will be helpful, and Shiropichu with the Brahmi Jatamamsi and Rasna Chuna, Shiropichu will be helpful. Then Stanashula, early pregnancy Stanashula will be mild, but sometimes some pregnant ladies in second and last trimester also there will be pain in the breast. Recently, two patients 2 weeks back came in the 34 weeks and 37 weeks with the severe pain in the breast. We treated her with the Dashangalep application, and Dhanvantara Vatti and Dhanvantaram Vatti, and hot water fermentation, and they got relieved by 24 hours. And we asked them to take apply Dashangalepa twice daily. And yesterday one patient had review, and there was no pain at all. So this is what we can do in the Stanashula. Then Arsha. So chronic pre-existing, the Arsha also may be there, which may get worsened during pregnancy. And for that, once again, we cannot give any Abhaya Arishta during pregnancy, but with the Trifala, Kashaya and Harita Kichurna orally, or maybe externally, Avagaha on that part. The sitz bath can be given with the Panchavalkala Kwatachuna along with Tankana Basma or Lavana, or Dashamula Kwatha or Trifala Kwatha. Avagaha can be helpful along with the application of Durvadi Ghrita. So that only will be helpful. But excision of Arsha is not helpful, not done during pregnancy, because it is contraindicated. Then coming to Garbhini Pandu, you may be surprised why I have included this, because it is not a minor ailment, it is a major ailment. But still, in a minor and a mild and moderate type of a Pandu, which can be, Pandu is a problem which can be prevented if Garbhini Paricharya is done properly since from the Prathama Masa, and or before conception only. If her iron reserve is maintained, then Garbhini Pandu can be prevented. Otherwise also it can be treated. So how we can treat Garbhini Pandu means Tatra Pandavamayi Snigdha Tikshna Urva Anulomakai. So Tikshna Anulomana Tikshna Aushadhi we should not use, but Snigdha treatment we can give. And so Jangala Mamsarasa, that's why it is told in the Panchame Mamsa Shonit Upachaya in the fetus. So there will be Mamsa Shonit Upachaya in the mother. So that can be prevented by giving Jangala Mamsarasa starting from the 4th month. So which is very rich in iron, and Dhatri Loha and Drakshadi Kashaya and Karjuradi Manta. and Dadima Sarasa. This will help in treating the Garbhini Pandu along with Punanama Mandura also will be Loha Basma, Loha Sava also can be given if it is in a third trimester. Dhatrifalam, Ikshurasam. So, Amalaki Swarasa and Ikshurasa and with Madhu will be helpful in treating the Garbhini Pandu. So it is not teratogens all are safe during pregnancy that can be given. So ST Madhu Kashaya should be given or the Chirapaka can be prepared and adding Madhu can be also given which helps in treating the Garbhini Pandu. And Neuradhatu Purana, if it is too much of anemia, the severe anemia, then blood transfusion is the treatment. Rasam Rakta Vardaka Patya. Rasa Rakta Vardaka Pradipaka Pachaka. Rasa Vardaka Patya, as I said, Dadima, Dadima Sarasa with Laja Manda, Dhanika, Hima, and Kharjura Dimantha. These things will be helpful. Mudgayusha, Mudgamalapa Yusha. These are helpful in increasing our blood, HB. Then Garbhini Atisara, not common, not uncommon also. So there Kalyana Kavaleha can be given and Methi Siddha Takra. Usually what I say them to take 1 spoon of Methi after washing it and with along with the Takra. That will be helpful many a times to in relieving the Atisara, and if it is still there, then Dadi Mastaka Chuna also can be given. But Kutaja Arishta, Kutaja Arishta was not indicated. So if it is in third trimester and 1 or 2 days of giving Kutaja Ganavati also will be helpful. So along with that, other ailments are like Udarashula, usually very common condition that Udarashula they come, and whenever the pregnant lady comes with Udarashula, we should ask which part of the Udara, whether above Nabhi or below the Nabhi. If it is above Nabhi, we know that it is maybe due to the Amla Pitta or Admana and Atopa. For that, Anulomana treatment can be given, like Madhifala Rasayana, Kamaduga with plain Kamaduga can be given. Or if it is around the Ambalika, then Dhanvantari Vati with Gudodaka will be helpful. And if it is lower abdomen, it should be investigated and assessed properly whether the premature labor pain or pre-abortal pain or urinary tract infection. And sometimes leg cramps also there will be there. For leg cramps, actually we give Kshirabala 101 drops with milk or Kshirabala capsule 1 BD and asking them to apply Pinda Taila on the Pratiloma Gati will be helpful. And also I am to keep that legs below the leg two pillows so that up Unnata Anunnata leg cramps. So to conclude, Garbhasama Yogakshema hi Garbhini Bhavet. This is a guidelines given by our acharyas. Whatever the ahara, vihara, aushada, whatever we take, we should think that there is a Garbha. So Garbhini always should take care of herself by protecting the fetus. Whatever Shema for the Garbha, that should be followed by the mother. And Sukshmam Chikitsam Vakshami Garbhinina Vibhagashaha Tatha Garbhascha Naricha Vardate Rakshate Api. So whenever the Garbhini lady gets any type of ailment, Sukshma Chikitsa, so the very sensitive or very delicate or very careful treatment should be given, which helps in Vardhata, in development of the Garbha and also Rakshana of Garbha as well as the Garbhini. Because we always should take care of the pregnant lady because she is considered as Purnamiva Tailapatram Sanshobhayam Antarvati Bhavatyupacharyaha. She is considered as the Taila Purna Kumbha. So when that should be taken care, otherwise it will Tikshna Aushadhi and any procedure will does the which irritates or which will be troublesome for Garbha as well as the So we have to be beware that what medication we are giving, because nowadays people, they just come Google and find out the teratogenesis, and they may question you. So we are answerable to public as well as the law. So we have to be very cautious whenever we are prescribing many medication. We should be in a position to answer when we are with diet and lifestyle. And I thank the organizers for giving this opportunity. And anything I left and any doubts, you are free to interact. Thank you.
Any doubts regarding this session? Ma'am, there is one question in chat box.
Can you please read it? Please read it.
Yes, ma'am.
Yeah.
Ma'am, question is what we can give for oligohydramnios?
Yeah. Oligohydramnios, okay, it is not included in minor ailment. That's why I have not included oligohydramnios, IUGR, and PET and GDM. Anyhow, it's a good question. Oligohydramnios, which trimester and how much less we should AFI we should know our limitation, because if it is early pregnant, like in the second trimester, if it is oligohydramnios and around less than 8, it's very, we have to think that any congenital anomaly is there. Can you hear me?
Yes, ma'am.
Yeah, we have to think. And whether IUG are also included, whether other like PIH is there, what is the cause? But in a third trimester and all, so because congenital anomalies will not be there in a third trimester oligohydramnios, and whatever after investigating properly, and we have to treat very cautiously. So we give here this Estimadu Churna Kshirapaka, 100 ml BD, and Karjuradi Mantha, and that that we call it as Narikela Pushpa. Narikela Pushpa, we prepare some leha out of that, and that will be given to the pregnant lady, and it is helping us in increasing. If it is in term and 36 to 37 weeks, and it is 8, and we are it is helping us to improve the improve the the liquor. But as a practitioner, we know that we cannot take that much risk in oligohydramnios. Anytime there may be inadvertent death. So very carefully by monitoring the AFI, we manage this. If it is not improving, then the amino acid drip, which is the proved treatment, that also can be given. But for whatever the kshaya, our concept is the vata vruddhi. So there that apatarpana is happened. That's why that is the kshaya. So we have to do the brahmana and vatahara line of treatment, and it will be helpful. So Kshirabala drops 101 with milk, as well as the what you call estimado churna Kshirapaka will be helpful. Hello.
Yes, ma'am. Any more questions?
Hello.
Hello.
Ma'am, if a patient is COVID positive in the 8th month of the pregnancy, what can we give in Ayurveda, ma'am?
If it is a symptomatic line of treatment, that's what we also give. Sudarshana Ganavati, Sudarshana Churnavati, we are giving 180 if there is fever. And Gokshura Kwatha we are preparing and giving. And I'm sorry, Guduchi Sattva can be given. And this is 8th month, Amrutottara Kashaya also we are giving.
Okay, ma'am. Thank you. And ma'am, for the weakness, if the patient is feeling too weak, what we can add?
Yeah. Generalized weakness, just to Shadanga Paniya. That's what we are giving. Shadanga Paniya, Jarahara, Ushiras. I mean, Shadanga Paniya actually we are giving sip by sip for her. It's a Jarahara also. It is Tarpaka also.
Okay, ma'am. Thank you, ma'am.
Okay, thank you.
Hello, ma'am.
Yeah.
Ma'am, there is another question in chat box. I am reading that. What can we use in hyperemesis in Garbhini who suffers throughout pregnancy by symptoms?
Hyperemesis, as a practitioner, we know that hyperemesis is very difficult with the Ayurveda only management. So simple emesis, which can be prevented. I mean, hyperemesis can be prevented by Ayurvedic management. But when it is hyper, we know that hyperemesis gravidarum is going to be turn into keto, metabolic ketoacidosis. So very difficult if her vitals are having problem, and she is already having ketoacidosis type of metabolic disturbances. Such things should be managed by modern medication only. But throughout the pregnancy, as I said, in our practice, we are very rare. I think I must say no only, because as soon as she is diagnosed with the pregnancy, we are giving this Ayurvedic patya only, Danika, Hima, Dadima, Sarasa with Lajamata and Madhifala Rasayana. So we are preventing the hyperemesis. But if it is hyperemesis, better integrated management with our patya, as well as whenever she is not able to, the control the vomiting, then we have to give antiemetic injections, IV fluids, and all. Integrated approach will be better.
Ma'am, there is another question in chat box. Hello. What should be our line of treatment in torch positive patient other than tablet sujat or torch nail?
See, torch positive pregnancy. torch positive pregnancy. It is not minor ailments. Today stop. What you are telling, I didn't get.
Ma'am, what should be our line of treatment in torch positive patient?
During pregnancy?
Yes, ma'am.
During pregnancy, torch positive. Hello. So torch positive usually, which positive is if it is a IgM, IgG, nothing to worry, it's not going to harm anyhow. If it is IgM, it should be aborted only, or it's very difficult the treatment. All of us know, right? IgG, it can be, we cannot say it is positive. It says that old infection is there. That can be neglected. That need not to be treated, IgG. And not which exactly the antibodies presenting, which is that organism, that also important. So thank you, organizer, for giving this opportunity, because there are patients waiting in my OPD. Sorry, I must conclude the session.
Okay, okay, ma'am.
Any doubts? You can take my number and you can WhatsApp me the question.
Yes.
Thank you. Thank you, Dilip sir, for giving this opportunity. Thank you. Thank you all.
Thank you so much, ma'am, for enlightening us with your knowledge and sharing your practical experiences with us. It will definitely benefit for all of us in our practice. So I declare that our second session is over here. Now I hand over the third session of paper presentation to my colleague, Dr. Payal Madhwani.
Thank you, Rutuja. Good afternoon, all. Myself, Dr. Payal Madhwani, PG first year student of Prasuti Tantra Evam Shri department. Now we are heading towards our third session of paper presentation. Due to great response for these sessions, we had selected best 15 paper instead of 10 for presentation. And our judge for this paper presentations are our Honorable Principal, Dr. Ashok Wali sir, and Research Department HOD, Dr. Anjali Upadhyay ma'am. Thank you, ma'am. So our third session of paper presentation will start within few minutes. Please be patient. Now I will announce 15 selected participant names and request them to be ready according to their number for presentation. So first one is Dr. Divya Srinath, second one is Dr. Divya Ramgude, third one is Dr. Samir Gholap, fourth one is Dr. Prerna Bandekar, fifth one is Dr. Pradnya Apattikar, sixth one is Dr. Punam Khoth, seventh one is Dr. Renu Yadav, eighth one is Dr. Kajal Modhave, ninth one is Dr. Mayur Mukund, 10th is Dr. Prajakta Vaidya, 11th Dr. Shrija Venugopal, 12th Dr. Vaishali Atri, 13th Dr. Shraddha Bhuvad, 14th Dr. Kiran Singh, and 15th Dr. K. Tilagavthi. I request every participant to end their presentations in 5 to 7 minutes. Sorry, one more participant is there, Dr. Varsha Gayakwad.
Before starting the presentation, I want to say what exactly the category to select the paper presentation or the prizes. The first one is the originality and the creativity. That is the theoretical and the clinical significance of the research, creativity, originality of the logic, timeliness and uniqueness of the ideas. It has a 20 marks. Second one, it is a logical presentation of the ideas. Objectives goal has been fulfilled properly. Methods are appropriate for the achieving goals. Results are clearly presented. Thoughts and ideas will go in a logical manner. It will contain again the 20 marks. Third one, presentation, oral presentation and delivery skills. Good body posture, maintains the good eye contact, audience, and good articulation. Fourth one, knowledge of the content, knowledge of material, familiarity of the subject matter, exhibit the knowledge of the subject matter, and answers the questions with the confidence. It has again the 20 marks. And the fifth criteria, it has a neatness of the charts and graphs, images, chapters, and the free of the marks and smudges, visual materials that has to be easily to be read. These are the criteria to evaluate, and the overall presentation, it is only for the 10 marks. So these are the criteria to select your research paper for the presentation. So I request you to start the session. Participant number 1, Dr. Divya.
Shall I share my screen? Shall I start?
Yes, Dr. Divya.
A very good afternoon to one and all. Myself, Dr. Divya Srinath, and today's topic is on Ayurvedic management of male and female infertility. The male is associated with an oligoastenospermia, and the lady was affected with PCOS. So, as we all know, there are infertility cases are rising worldwide, and now it is considered that it is the third most difficult disease to cure, like following the cardiovascular disorders and the malignancy. So there are so many factors contribute to infertility, like it can be a female factor, a male factor, or a multiple female factor cases also we can see now, and like combined factor, both male and female are affected. So this case is a combined factor. Like we'll start the case. So this is a lady of age 21 years old and the husband of age 28 years. And they came to my APD on 16/12/2020. And the lady is like hearing impaired lady. So she's a student also, like a paramedical student. So it is difficult for me to admit in the OPD. So I had to manage with an OP management only. And this lady was having like irregular cycles. And the couple was married since 2 years. And since like after 1 month, they were planning for a baby because the husband had to go back to his workplace, like in Dubai. So they were planning for a baby from the 1 month after marriage. And this lady complains of like irregular cycles. She's having like oligomenorrhea. Her cycles were like 35, 38 days duration. And when the bleeding is like spotting only, like brownish spotting only for 1 or 2 days, that was her main complaint. So on examination, what I find is that she's having like hirsutism, is there, acne is there. Acne, when I was inquiring about, she told me that she is having the severe acne for like past 1.5 years. She is having this acne. So the hirsutism and acne, both were the like the symptoms of hyperandrogenic state. And also she was having this acanthosis nigricans, that is blackish pigmentation around the neck. So it is a typical sign of insulin resistance is there. And the lady is like a moderate build. She's only like 5 to 7 kilos more than the like normal BMI. And the one thing is noted is that she suddenly increased 4 kilos after her marriage as a part of this parties and all after marriage. So this was the presenting complaint and examination result. And owing to investigation, even though we find that there's a clinical signs of hirsutism or hyperandrogenism is there, insulin resistance is there, so I just simply done a USG of the lady. And also the husband, when I was inquiring the case, he was having an elevated liver function test and fatty liver. He was staying outside the country, and his diet and lifestyle was entirely like in a really in a best situation. So this elevated liver function was there, and I advised him to do a semen analysis also. So when the semen analysis report came, it is clearly mentioned that the rapid progressive mortality was like only 5%, and the total count, you can see here, the total count was only 9 million was there, and the volume and other parameters were normal, and he was diagnosed as oligoastenospermia. And for the lady, we can see that the ovarian volume was increased, like about right and left ovarian more than 10 cc was there. And like the typical polycystic pattern was seen. So as per the Rotterdam criteria, the three symptoms like the clinical signs of hyperandrogenism, the polycystic ovaries and USG, and oligomenorrhea. So the three symptoms was present. That's the typical phenotype A type of PCOS pattern was seen in this lady. And even though nowadays we can see that some even the BMI lady more than like 28 or 30 ladies without PCOS we can see. So there is definitely a role of genetic predisposition is there behind this PCOS. So sometimes lean PCOS we can see. So definitely a genetic role is there. The mother of the lady is also having a PCOS during her reproductive phase. So there is a role of genetic predisposition is there. And like when we are looking into the pathogenesis, we can see the insulin resistance is there, the hyperandrogenism, hormone imbalance at elevated LH-FSH ratio, you can see. So even we are considering the ovarian factors, we had to consider the insulin resistance and the liver function also, because there is a reduced sex hormone binding globulin is there, and also there's an increased testosterone is there. So we had to like correct the liver function, and also we had to correct the insulin resistance. We had to advise a proper diet and lifestyle, especially to reduce the madhura ahara and all. We had to advise along with the management of the ovarian function also. So the more we can see the clinical features of Arthavakshaya is like Edojita Kala Darshanam. Symptoms of Arthavakshaya is that if it is not taken properly, it may lead to like Nashtartha, like into amenorrhea state. So we had to, when the lady comes, it's in the Arthavakshaya state. So we had to do the management accordingly. And so along with the medicine, I advise her to do a proper diet restrictions and proper like exercise, like to sweat, Swedagamanam, especially in the forehead and all that much. Like she had to do exercise, especially in the follicular phase. That will support her normal ovarian function. And also she was like in a very much stressful situation. So I'd advise her to do like a music therapy, like to hear this Kalyani Ragam, Mohana Ragam. They are having very good effect on the like the psychological aspect also. So Sattvaja chills also we had to consider, especially in cases like infertility. So this was the timeline of the treatment. During the early visit, her periods was like on 28th November. There was a spotting was there, and again the cycle duration was like 35 days. Then after third visit, her cycle became regular and the bleeding became normal. 5-day moderate bleeding was there. So the common medicines which I given was like Saptasaram, Sugumaram, Kashayam, Kumariyasam, Shatapushpa, Sharibadhyasam and all. This Kumariyasam, Sharibadhyasam was mainly given to correct the liver function, to support the liver function. And Shatapushpa is having a very good effect on the Artava. So it may support her Artava. And also Jiraka Arishtam, we are having a very good result in to promote the ovulation, especially in the follicular phase. When you're giving this Jiraka Arishtam, it may support the proper ovulation by correcting the acne and all. So these Kalyana Kashayam was given because she was having a psychological stress and all, because her exams was coming at that time. So in order to support that, I had given this Kalyana Kashayam. So this was the prescription. And for the male, so this oligoastenospermia, that is the progressive motility was less, the count was also less. So in this condition, I had given, and also he was having this elevated liver function and all. So initially I had given this Homeopathy, especially Pitta Shamana type of medicines like Ayurveda, Guluchadi Kashayam, Brihatyadi Kashayam. And after that only I had given medicine to support the normal sperm production, especially Chiruvilluvadi Kashayam, Kalyana Gulam, Maharashtra Kashayam. In the Kashaya itself, it is mentioned that it can be given in Vandya and all. So he was having like a borderline diabetic. So I had added Nishakatakadi Kashayam. And then the Vaishwan, the Churna Abhyarishtam Danadharam tablet combination has a very good effect on the Samana and Abhana Vayu. So for a male reproductive function, the proper function of Samana and Abhana Vayu is very important. So this was a prescription which I was given for the male subject. So when you are discussing about the like the Samprapti Katakas, we can see the ladies having like the Vada Kapha dosha predominant, and the male is having like Pitta Kapha Shamana line of management we had to adopt. Along with considering the psychological aspect and also diet and lifestyle modification was advised for both the subjects. And these patients were like typically Vishakvashya patients. So it is very easy for us to advise the diet and all they will follow correctly. On March 30, they were the UPT came to be positive. This was the first scan report. And during the pregnancy time, or glucose tolerance test was a little bit elevated. So I added Nishakatakasham as Thoim for the lady. And she was also having this elevated thyroid function. So the thyroid 25 mg was started by the allopathy doctor and all. So this lady delivered a healthy baby boy on 16/11/21 of weight 2.69 kilos. So as we all know, there are so many multiple factors lead to infertility cases. Both the male and female cases are rising. And this case I had to manage with OP management because the lady was she was like a student and she had to go to college regularly. So even with simple OP management, we can manage infertility cases, and also we can reduce the like treatment expense or the burden to the patient. And also always try to incorporate, along with managing the bodily issues, along with managing doshas, also try to consider the psychological factor also, especially in cases with infertility. That is the message I want to convey. Thank you so much. Thank you for your patient listening, and thank you for giving me this opportunity. Thank you.
Thank you, Dr. Divya. Thank you. Next presentation should be Dr. Divya Ramgudi. Dr. Divya Ramgudi, are you here? Presentation, Dr. Samir Golab. Dr. Samir Golab.
I'm here. Madam, I'm here. Can I start?
Dr. Samir Golab.
Yes, madam, I'm there.
Okay.
Can I start, madam?
Yes, sure.
Yes. Good afternoon, everybody. My topic today is to study of the efficacy of Panchakolas in the Yavagu in Sudhika Paricharya in decreasing the incidence of secondary PPH, evidence-based case study. My name is Dr. Samir Golab, working as Associate Professor at SUPRAJA Medical College. PPH is a major cause of maternal mortality and morbidity. Secondary PPH has very less incidence, say 1 to 2%, but the mortality and morbidity rate is very high, up to 40% in India. The most important cause of secondary PPH is placental remnants in the uterus. Garbhashe Shodhana, Vatishamana, Dipana Pachana, Valya Aushadhi are the basic principles of postnatal care in Ayurveda. According to the all classics, in Sudhika Paricharya, Garbhashe Shodhana Dravyas are indicated in first few days in the form of Panchakol Sudayalagu or Panchakol Churna. It causes the expulsion of placental remnants and hence good involution of the uterus. There is no clear or standard definition for the quantity of the blood loss associated with secondary PPH, but the clinical expression for its definition vary from increased lochia to massive bleeding. Cause of secondary PPH explained as 4 T's, that is stone, trauma, tissue, and thrombin. My research question is Panchakol Sudayavagu is effective in Sudhika Paricharya? Null hypothesis and alternate hypothesis. Primary objective is to study the efficacy of Panchakol Sudayavagu, and secondary objective is to study the efficacy of Panchakol Sudayavagu with with respect to pain, involution of uterus, lactation, and appetite. Materials is CRF, Panchakosha Yavagu, which is prepared as per the Sanhita Granthas, and standardized sanitary pads to evaluate per vaginal bleeding. Study type. It is a two-arm control or randomized clinical trial as a pilot study was performed to evaluate the efficacy of Panchakosha Yavagu in decreasing the incidence rate of the secondary PPH. 1,000 patients were taken with normal delivery. As the incidence rate of secondary PPH is 1 to 2%, the samples of the 1,000 patients were selected as a pilot study. Two groups were, the 1,000 patients were classified into two groups, A and B.
Hello, Dr. Samir.
Yes, madam.
Dr. Samir.
Yes, madam.
Sorry to interrupt you, but your slides are not moving.
My slides are
not moving.
It is moving, madam. 1 second. Madam, it is moving from my side. 1 second. I will just check. Okay. Share screen is there, madam?
Yes, sure.
It is there now. Can you see?
Yes, sir. Yes, sir.
Okay. 1,000 patients were classified into two groups, A and B. A group was Panchakosha Yavagu, twice a day before meals with lukewarm water as anupana for first 10 days of the puerperium. And group B was observational group and was given conventional treatment, that is injection pitocin, 10 international units intramuscular immediately after the delivery of the baby. And all the patients were observed on weekly interval for 6 days of the puerperium and assessed for the secondary PPH. Diagnostic criteria was PV bleeding after 24 hours of the delivery and before 45 days. More than 300 ml of blood loss in 24 hours, that is complete soaking of more than 5 standard sanitized sanitary pads in 24 hours. Definition of Yavagu, as everybody we know, Siktar Yuraito Manda, Peya Sikta Samandita, Vilepi Bow Sikta, Syat Vilepi Virata. Qualities of Yavagu, we know, Dautostu Bimala Shito, Madotnya Surabi Yapsama, Swinna Suprasidas Kushno, Vishadas Tuadonasato. A textbook reference we get in Kasham Sahita, Kiristan, and Jagat Sahita, Sharistan, 8th Adhyay. Qualities of Panchakola Churna, everybody we know, Panchakola Sepakim. Benefits of Anupana, everybody we know. Anupanam Paraturja, Trupti Vyapti Duranganam, Anga Sangata Shetilya, Vikliti Jarananisha. Panchakola Churna, everybody we know. Dikshna Ushna Pachanam, Sreshta Deepanam, Kafavatanud, Gluhuma Palihodara, Ana Shulagna Pittakopanam. Qualities of rice, Lagu, Sugandhi, Kafaha, Vidnaya, Pushtudandula. With respect to the spatial pathophysiological stage of the Sudika, Panchakol Siddha Yavagu is considered to be Deha Satmiya, Desha Satmiya, as well as Vyadhi Satmiya. I mean to say Sada Patyakar, Sada Hitakar for the Sudika. Assessment criteria, pain in abdomen, appetite, lactation, and involution of the uterus. Age-wise distribution, number of gravida 380 primies, 496 were second gravida, and 124 were multi-gravidas study. Prolonged labor 12 cases in group A, group B 10 cases, group A 11 cases of primary PPH, 16 cases of group B secondary. Number of incidents of retained placenta 4 and 3 in group A and group B. Secondary, this is very important slide. Incidents of secondary PPH were observed in only 2 patients in group A, and group B there were 6 patients in group B. This is the assessment criteria. Z value, as everybody we can see, pain in abdomen, appetite, lactation, and involution of the uterus. Other than lactation, group A was significantly better as compared to group B. Katurasa, the action of Panchakol is the Yavagu. Katurasa, Tikshna Guna, Pachana, Ruchikara, and it is having the best Dipana property. Anaha, Shulanashaka, Pachana Guna, and Kafa, Vata, Nashaka. It is the Guna of Panchakol is the Yavagu. Everybody we know this. It clearly indicates that Panchakol Yavagu is a good medicine to cleanse the uterus and contracting it properly, which prevents the secondary PPH. So Acharya Kashyapa has given the resource of Kashyap Sahita Khirastan 10th Adhyay, and also Acharya Charaka in 8th Adhyay of Sharirasthana. So the conclusion, Panchakol Yavagu regimen 30 ml BD, it significantly reduces the secondary incidence rate of the secondary PPH. It decreases the pain in abdomen and anorexia. It It causes better and early involution of the uterus than normal. It does not affect lactation, and very important, ADR is not seen in any patient during and after the clinical trial. Scope for the further study. Considering the less incidence rate of the secondary PPH, in spite of big sample, we can consider this as a pilot study. Therefore, this study can be done with big samples like 10,000 or more in different geographic or socio-economic conditions to confirm the results. As we know, secondary PPH is a life-threatening disease with high incidence of maternal mortality. Ayurveda has definite answer to this morbid condition in terms of preventive as well as therapeutic measures. Preventive aspect includes the Sudhika Paricharya. Therapeutic aspect should include the integrated approach, that is Panchkarma Yavagu, along with injection pitocin 10 units in deep intramuscular immediately after the delivery. This approach should bring maternal mortality and morbidity practically zero. This will help us to achieve the goal Swasthya Sudhika, Swasthya Bharat. Thank you very much. Thank you, madam.
Okay, thank you, sir. Dr. Samir, thank you very much.
Yes, madam. Thank you very much.
You have a nice presentation. The methodology of research is also correct.
Yes.
So I ask the next participant, Dr. Prerna Bandekar.
Hello, am I audible, ma'am?
Yes, ma'am.
Yes, ma'am. Good afternoon, everyone. Welcome to my presentation. To start presentation. Ayurvedic management of Perikartika, acute fissure in ano in Garbhini, a case study. Abstract. Among anorectal diseases, Perikartika fissure in ano is considered one of the most painful diseases. Nowadays, the incidence rate of this disease become more due to the irregular food habits as well as improper modern lifestyle changes. So nowadays is separate disease, but in the history it was mentioned a complication of some disease or some Ayurvedic procedure like Basti. Acharya Kashyapa has described Perikartika as complication in pregnancy. This case study described the effective management of acute fissure in ano, which was managed with Ayurvedic treatment modalities. A 27-year female patient came with symptoms of pain and burning during and after defecation, and also having the presence of blood streak while passing of stool. The patient was diagnosed as acute fissure due to presence of cut longitudinal ulcer in lower part of the anal canal at the 6 o'clock position. Ayurvedic treatment approach both internally and externally were followed. Jatyadikritam Pichu application followed by lukewarm water with Panchavalkala Kvata seeds bath was advised as external treatment. The complete improvement was found in this within 8 days of treatment. No reoccurrence was noted even after 3rd month of follow-up. Next keywords: Perikartika, fissure in ano, Jatyadikritam Pichu, and Triphala Kuguru. Introduction. In Ayurvedic Samhita, this Perikartika is described in different phases. In Samhita, it described as complication of Virechana vapor, therapeutical. In Sushruta Samhita, it described as Basti vapor. In Kashyap Samhita, mentioned it as a Garbhini vapor. Fissure in ano has become most common and painful condition in anorectal disease. It is commonly seen in young age peoples and pregnant women. It is very painful because of injury to somatic nerve supply to the anal region. In modern science, treatments include analgesics, antibiotics, laxatives, and ointment, and anal dilatation, sphincterectomy, fissurectomy. Surgeries of fissure in ano are expensive and require long stay in the hospital. All these procedures having its own complications. In Ayurvedic, there are so many preparations and base surgery procedure also. The condition fissure in ano commonly encountered in anorectal practices has similar location, pathology, and clinical feature of pericardica like anal pain, burning sensation at anal, constipation, and stool stick with blood, etc. Case report. Move to case report. A 27-year female patient, primi gravida, 12 weeks of gestation, came to on 28/10/2021 with chief complaint of Guda Pradesha Kardanvat Vedana, Guda Pradesha Daha, Malavashtamba, Sarakta Malapravrutti. Patient had above complaints since last 15 days. Her Rajo Vrutanta was regular menarche attendant at 15 years of age. And she is not known case of thyroid dysfunction, diabetes mellitus. Dietary habits, she will quantitatively less intake of meals along with non-vegetarian diet. She had history of irregular bowel habits since 15 days and no history of day sleep. Dashavidya Pariksha, Prakriti is Vata Kapha, Vikruti Hetu Akala Bhojana, Asatme Pojana, Tauritra. Dosha, Vata Pradhana, 3 dosha, Dusha Rasa, Desha, Sadharana, Bala, Madhyama. Ashtasthana Pariksha, Nadi, Mutra, Jivma, Shabda, Sparsha, Dhruv, Akruti, all are Prakrut. In Mala, once in 2 days, irregular and Malavashtamba. In local examination, inspection, active bleeding was seen at the anal canal visualized. A longitudinal tear extending from anal verge was seen at the 6 o'clock position. Digital rectal examination, it was not done as the patient had severe pain due to sphincteric spasm. These are the investigation. It's done on 12/10/2021. This is a USG report. Diagnosis, acute fissure in ano, pericardica. Material and method. Center of Study, Honorable Annasaheb Dange Ayurved College, Postgraduate and Research Center, Ashta, Sangli. It's simple single case study. Material, internal and external application medicine in case study. These are the medicine which given internally and externally. Jatadikruta Pichu, 2.5 ml twice in day for local application. Avgaha procedure in case study. I told the patient to take seeds bath with Panchavalkala Kwatha twice in days. Zarpatya. Nidana Parivarjana, avoid spicy oily food, increase liquid intake, drink more water, Lajamanda, Mutkayusha, milk. In table 4, showing regression of symptoms during treatment. So in pain, sphincter spasm, burning sensation, constipation, stool stick with blood, these all symptoms are, in first day there are severe symptoms, in second, third, fourth, fifth day it was moderate to mild, and in 6th day it was mild, and 7 and 8 days all symptoms are relieved. Discussion. Patient got relieved of the symptoms and improved with Jatadikruta Biju, and probable mode of action revised as below it is. Internally, I have given to patient a Triphala Gugulu. That mode of action of Triphala Gugulu is Shodagna, Malasara, T-Doshakna, prevent constipation, help for healing fissure. In Jatadikruta Biju, Vranashuddhika, Vranaropaka, lubrication, and Avgahan, Shodagna, Vatashama, and healing activity. Discussion. In this case, pregnancy is the root of the cause along with the diet, and the removal of these causes along with the proper Ayurvedic treatment and consultation regarding diet and lifestyle has given excellent result. Next, moving to conclusion. Proper management of according to specific condition will show magical result in Ayurveda. This is a case is one of the best example of magic of Ayurveda. And these are the references. Thank you.
Thank you, madam. Thank you, Dr. Prerna. I ask Dr. Pradnya Atpadikar, Aptekar. Dr. Divya Ramgude is here. Dr. Pradnya Aptekar.
Yes, madam. Yeah. I will start. Just a minute, madam. I will share my presentation first. Disable, actually, the host has disabled the sharing. Please enable the sharing. Host.
Wait. Yes, ma'am.
Yeah.
Now you can share.
Yes, madam. Okay, madam. Is it visible? Okay. Shall I start? Am I audible? Na? Okay. Hello.
Yes, ma'am.
Yeah. Hello, everyone. I am presenting a review article, Role of Agni in Arthotpatti with special reference to Trikatu. To study and review the available references to understand the role of Agni in Arthotpatti, to understand the role of Deepaniya herbs in Arthotpatti, and to introduce a new view regarding Dhatu Upadhatu relationship with respect to Ahara Rasa. References have been taken from available Ayurvedic texts, Kashyap Samhita, Bishajya Ratnavali, Charak Samhita, and etc. And also modern texts, websites, and research papers have also been researched and studied. Literary review. Some of published articles also show that the Deepaniya herbs are being used in unpublished cases. Here, in the first case, the Hingu is enlisted in Deepaniya Dragana. Then the second paper is about the Garbhaprada Yoga, which contains Trikatu and Nagakeshar. We get the reference of Garbhaprada Yoga in Bhaishajya Ratnavali, in Yoni Vyapat Chikitsa Adhikaran. Trikatu is also
Dr. Pradnya.
Hello. Hello.
Doctor, please unmute your mic.
Yes, unmuted. I think something network connection is problem. Second slide was visible, second and third. Or am I start with first slide again?
No. First unmute your mic and now start the presentation.
I'm unmuted.
From the second and third.
I'm unmuted. I'm unmuted, madam.
Okay, sure.
Yeah.
Your presentation
second
is not
and third,
visible.
na? Okay, I have to again share my, I think.
Yes, you have to again share.
Yes. Is it visible now? Okay, madam, is it visible? Is it visible, madam?
Yes, it is visible now.
Yeah, sorry for the internet connection. I think this created some problem from my side. I think I don't know. So I'm starting my presentation. Hello everyone. I'm presenting. Hello. Hello everyone. I'm presenting a review article, Role of Agni in Arthotpatti with special reference to Trikatu. Aims and objectives: to study and review the available references to understand the role of Agni in Arthotpatti, to understand the role of Deepaniya herbs in Arthotpatti, and to introduce a new view regarding the Dhatu Upadhatu relationship with respect to Ahara Rasa. Textual materials have been used for this study. Various references have been collected from the Ayurvedic texts, literature like Charak Samhita, Sushrut, Bhaishajya Ratnavali, Kashyap Samhita, etc. Related modern texts, website, research papers have also been searched and studied. Some of the published articles also show that the Deepaniya herbs are being used in anovulation cases. In the first case study, Hingu Vachari Churnam is used, in which Hingu is enlisted in Deepaniya Dravya, Deepaniya Gana. In the second paper, in the second article, Garbhaprada Yoga is used, which contains Trikatu and Nagakeshar. So we get the reference of Garbhaprada Yoga in Bhaishajya Ratnavali in Yoni Vyapat Chikitsa Adhikaran. In this yoga, the Trikatu is used, which is a Deepaniya Dravya. It is also enlisted in Deepaniya Gana. Sushruta says that Artava is Agneya. The dominant Mahabhuta in Artava is Tejas. We also get reference of the use of Agneya Dravya to induce ovulation. Sushruta says that we should use Sangshodhana like Vamana, etc. and Agneya Dravyas to induce ovulation. Because of vitiated kapha and water, in such condition, we should use medicine which is the same character or having the same quality, that is the Agneya in character. Hence, Deepaniya Dravyas are important. Commentator Dallana that during the process of forming of Artha is due to influence of Rasa, while at the time of ovulation, due to specific changes, it assumes Agneya in character. This Somya to Agneya character change in the same way as solid substances are changed into fumes due to the action of fire. For this, he has given the example of canned juice, which is changed after fermentation into wine. So, Ahara Rasa is divided into two parts in females to form Artava Dhatu and Rasa Dhatu. According to the commentator Aruna Datta, he says that Raja Upadhatu is formed from Rasa Dhatu and Raja Dhatu, that means Artava Dhatu, Stri Bija, is formed from Ahara Rasa. Now here you can see how Ahara is getting into part 1 and Ratvangsha part 2. Here, role of Agni, Jataragni, Panchadhatvagni, and Panchabhutagni and Dhattvagni, all are very important. Here, in this slide, you can see how the Artava Dhatu is formed from Ahara Rasa and Raja Upadhatu is formed from Rasa Dhatu. So in women, Artava and Rasa Dhatu, and then from Dhatu, either Raja or Stanya Upadhatu are formed according to the stage of woman, avastha of the woman, that is lactating or non-lactating. Active site of Samanavayu is adjacent to Agni. This Sahacharya is always Jataragni and Dhattvagni. Samanavayu always stimulates Agni, and Agni means here the metabolic power. In the human body, Agni is present in the form of Pitta. When it is in normal condition, it performs its physiological functions. Pachak Pitta is equivalent to Jataragni. All Deepaniya herbs are Ushna, Tikshna and Katurasatmak. All Deepaniya Dravyas are Pitta Vardhak and hence Jataragni and Dhattvagni and increase the power of metamorphosis of Dhatus from Ahara Rasa. According to previous discussion, comments from Dallana, At the time of ovulation, there is specific change from Saumya Rasa to Agneya Artava. Due to the action of Deepaniya Dravyas, these change may happen. It stimulates the growth of follicle and further rupture of follicle, that is ovulation. Hence, such Deepaniya herbs are being used in anovulatory cycle. The Trivshana, that means the Suntha, Maricha and Pipali, are the best Deepana Dravyas and are used in the patients of anovulatory cycles. So the conclusion from this review article, we can understand the role of Agni in Arthavatpatti. Deepaniya Dravya stimulate and increase the metabolic power, that is Agnibala Vardhana, and create the chain of quality dhatus. Ahara Rasa and Rasa Dhatu, etc. depend upon the quality and quantity of diet and Agnibala. Raja Dhatu means Artava is formed from Ahara Rasa and Raja Upadhatu is formed from Rasa Dhatu. Thank you so much.
Thank you, madam. Dr. Poonam Khote.
Good afternoon,
Dr.
ma'am.
Poonam Khote.
Good afternoon, ma'am.
Okay.
I'm audible, isn't it, ma'am?
Yes, you are audible.
Ma'am, my screen is visible?
Yes, it is visible, ma'am.
Thank you, ma'am. Good afternoon to all. I am Dr. Poonam Khote, Associate Professor, Department of Prasuti Tantra and Shri Roga, Himalaya Ayurved Medical College, Dehradun, Uttarakhand. So today I am presenting a case study on Yoni Vrana. Ma'am, just a minute. I'm just coming to introduction. Acute genital ulcers are also known as acute vulvar ulcers or lip squeeze ulcer. It is an ulceration of the vulva or lower vagina of non-venereal origin that usually present in a young woman. It has been considered as a uncommon and probably underdiagnosed entity, although a recent study has reported that it may present around 30% of the vulvar ulceration. It may affect the adolescent and reproductive age groups of a woman. Acute genital ulcers are painful and distressing to a woman, usually wider in 1 centimeter and deep, with red border covered by a gray exudate. So their etiology and pathogenesis are still unknown, but recent research work says the infection may be of the ulcer may be of infectious or non-infectious, where infectious include all the sexual transmitted diseases, where non-infectious includes any sexual trauma, psoriasis, or any autoimmune disease. So these things can be diagnosed, and according to that, it should be treated. So the treatment here is symptomatic. So in Ayurveda, all authors have described Yoni Vapad in a different chapter, but as a Yoni Vrana, as a disease or a symptom, it is not directly mentioned. But word Yoni Vrana is available in Ashtanga Sangraha in the context of Yoni Vranekshana Yantra. The phenomena which causes the destruction of the tissue in a particular part of the body is termed as Vrana. So Ayurvedic texts have described about various Sthanika Chikitsa for the management of Yonigata Rogas. These Sthanika Chikitsa act on Sthanika Dosha Dushti and helps to relieve the symptoms like vulvar itching, vaginal discharge, foul smell, pain, burning sensation, vaginal infection, and inflammation. Coming to the objectives of this study is clinicians should be aware of this rare condition to avoid the misdiagnosis and unwarranted investigations into false accusations of sexual activity. So method here I am presenting a case of 14 years old girl with systemic symptoms and vulvar ulcers of unknown etiology. So the case report, 14 years old female student represent to the OPD of Uttaranchal Ayurved Hospital on 19/1/2019 with the complaints of Yoni Vrana, Yoni Shotha, Yoni Srava and Mutrakricha. Since 4 to 5 days history was there. History of fever was there just 2 days back, and history of flu-like symptoms were there 10 days back. So past history, when we look, Patient was having a flu-like symptoms and took contemporary medications and got cured from that. But after that 5 days, she developed fever along with the painful vulvar ulceration, along with burning micturition. For that, she got admitted there and took treatment of 3 days. But she didn't find any relief. For that, she took discharge and she visited to a hospital. So there was no any history of oral aphthous ulcer or no history of sexual activity, sexual abuse, or a physical trauma. Family history was nothing significant. Personal history, she used to take a mixed food. Appetite was reduced during that period. Bowel was clear. Micturition was 4 to 5 days, but burning sensation was there. Sleep was disturbed due to that burning sensation and severe pain was there. Menstrual history, menarche was at 13 years. Her LMP was just 4 days before the admission, that was 16/1/2019. Menstruation cycle was regular. She used to bleed for 3 to 4 days of 30 days cycle. General examination, build for moderate, pulse Hg. On the time of admission, she was not having any fever. She was totally afebrile. Then height was 170 centimeter, weight was 44 kg, tongue was coated. Pallor icterus edema was absent. Systemic examination where CVS, CNS, respiratory system, all were normal. Per abdominal examination shows soft, non-tender, no organomegaly was found. But when we see for a per vaginal examination, there were multiple ulceration at bilateral medial aspect of the labia minora. The ulcers were kissing each other. It was like a kissing ulcers plus edema of a bilateral labia minora was present. White mucoid discharge were present and there was severe tenderness. Lab investigation, hemoglobin was 12.8 gram per dl. TLC was mildly raised, that is 9,200. RBS was normal, 94 mg per dl. We went for the this VDRL and HIV test. Both were non-reactive. Urine analysis shows no evidence of any infection. Ulcer swab shows only Enterococcus faecalis. USG abdomen and pelvis was normal study. Coming to the methods or the intervention, oral medication was given. In that we put Trifala Guglu 500 mg twice daily, Haridra Khanda 3 grams BD for 15 days, Punarnama Kwata 20 ml with equal quantity of water for 15 days. Along with this, we included Sthanika Chikitsa, Yoni Dhavana with Panchavalkala Kwata for 7 days, Yoni Pichu with Jatyadi Taila for 7 days. So this was the method. For she came to our OPD on 19th and she got admitted there and she discharged on 24th of January 2019. She was there for 6 to 7 days in our hospital. In that, oral medication were given for 7 days. Trifala Guglu, Haridra Khanda, Punarnama Kwata twice daily, and Sthanika Chikitsa, that was Yoni Dhavana with Panchavalkala Kwata, Yoni Pichu with Jatyadi Taila, that was given for 7 days. And we observed that Yoni Vrana has only little improvement was seen in Vrana, where Shota was reduced, Yoni Srava was reduced, and Mutra Krichra was decreased completely. And after that, after 1 week of that, she came for a follow-up. That was on 31st January 2019, where she was put on a oral medication, Trifala Guglu, Haridra Khanda, and Punarnavadi Kwata with the same dosage. There we have seen that Yoni Vrana was reduced only moderately. Then again, she called for a follow-up on 7th of February 2019, where we prescribed her Trifala Gugul and Haridra Khanda for another 7 days. So total duration was 20 days. And after 20 days, the whole Yoni Vrana was healed completely. Otherwise, symptoms were healed, like Yoni Shota, Yoni Srava, Mutra Krichra were reduced within 7 days, but Vrana took 20 days. So this was the diagram. We can see labia minora is having swelling, and these were the ulcers. We are unable to even expand that ulcer. That much severe pain was there. This was on 19/1/2019. And after treatment, it is after 15 days, we can see still the ulcer, but it is healed. It is a Shuddha Vrana. Swelling of minora has reduced completely. And it is after second follow-up, that is on 7th February, only little mark, we can see all the ulcers are healed completely. Swelling of the minora has reduced completely. So total duration she took was 20 days. Coming to the discussion, Trifala Guglu is known for wound healing activity. It also has antimicrobial property in wound healing and inhibiting the hyaluronidase and collagen activity. Gugula has anti-inflammatory action. So Trifla Guglu will act as a Vatanulomaka, Shotahara, Amahara, and Pranaromaka properties, where Haridrakanda is usually indicated in inflammatory disorders, where the various ingredients of Haridrakanda are having Vata Shamaka and Sidosha Shamaka properties. The main ingredient of Haridrakanda is Haridra, which does the Lekhana Karma, digests the Ama, Meta, and Kapha, and also does the Rakta Shodhana. And other ingredients of this Haridrakanda has Deepana and Pachaniya Guna. It also acts as inflammatory and anti-allergic activities. Punarnavadikwata is also having Tikta, Vashaya, Rasa, and it has Deepana Pachana Gunas. It also acts as a Kafavata Shamaka, Kledagna, Shodagna. It has the Mutrala Guna and even Rasa Shodhana properties, and it acts as anti-inflammatory and diuretic properties. Where Yoni Dhavana with Pancha Valkalakwata, all the 5 ingredients of this Pancha Valkalakwata having the Kashaya Rasa as a dominant, useful in the management of Vrana and Shota. It acts as a Vrana Shodhaka, Shotahara, Vedana Sthapaka, and Ropaka activities, and it also enhances the fast healing of Yoni Vrana by cleaning the debris from the Vrana. It also has antimicrobial activity, antibacterial activity, and wound healing and anti-inflammatory activity. Where Jatadi Taila Pichu, ingredients of Jatadi Taila is having Shodhana, Ropana, and Vedana Sthapana properties, and Pichu helps for the medicine to remain at the site for a longer period for the better action. Coming to the conclusion, acute genital ulcer is an uncommon and underdiagnosed disease that typically occurs in a young woman. In Ayurveda, there is no direct reference of Yoni Vrana. So Yoni Vrana can be compared here with a Twak Mamsaja Vrana. The internal medications like Trifada Guglu, Haridrakanda, Punarnavadikwata, along with Panchavalkala Yoni Dhamana and Yoni Pichu with Jatadi Taila provided significant relief in all the symptoms of Yoni Vrana. So these are the list of reference. And thank you. I'm very much thankful to the management of Anna Dange Ayurved Medical College. I'm very much thankful to the principal, Dr. Ashok Wali sir, Professor and HOD, Dr. Dilip Katavre sir, and organizing secretary, Dr. Khalache sir. Thank you, one and all.
Thank you, madam. Thank you. Is Dr. Divya Ramgoda is there? Okay. Dr. Renu Yadav. Thank you, Dr. Poonam. Hello. Dr. Renu Yadav.
Yes, ma'am.
पेशंट माझ्या अंडर पडलाय ना फाईल तुमच्या नाव पडलंय ना फाईल
Good afternoon, everyone. My topic for case presentation was the management of Garbha sauce with Sheer Basti. First of all, I am giving a brief summary of the case. The SUPRAJA Janan concept of the Ayurveda was a prime concern since old era. Thus, Garbha sauce is revealed one of the diseases which can be correlated with intrauterine growth retardation, that is IUGR, due to its similar pathology and clinical sign and symptoms. Aim of presenting this case with IUGR is to review the effectiveness of the Ayurvedic treatment modalities for Garbha sauce with respect to IUGR. In classics, Acharya Shushrut mentioned Garbha sauce as Vatabipan Garbh and Garbhashya. Also, Acharya Charak described Garbha sauce while describing Garbha Vyapad. And clinical feature of Garbha sauce, Garbhashya and Vatabipan Ras was similar to IUGR. Intrauterine growth restriction is said to be present in those babies whose birth weight is less than 10th percentile of average for the gestational age as per race, gender of the fetus, and area. Now, most common cause of IUGR is blood flow to the fetus is compromised. In Ayurveda, predominant Vata dosha and nutrition as a causative factor for Garbha sauce. For diagnosis of IUGR, determination of gestational age is the utmost important factor. Thus, ultrasonography before 21 weeks considered more accurate for determining gestational age. Clinically, we diagnose IUGR by measuring symphysis fundal height and abdominal girth of the mother in fetal biometry Abdominal circumference is the most accurate parameter, and HC-AC ratio and FL-AC ratio also considered as important diagnostic tool. Now, coming to the case, a primary gravid of 20 years reported to our PTSR department OPD for ongoing regular ANC checkup. On this ANC visit, we found that her fundal height was less than the period of gestation. So, we on further inquiries give history of normal ANC checkup, normal iron calcium supplementation, and normal early scan and anomaly scan. Now we advise her for USG for growth scan, which is comes to suggestive of IUCR. So we treated her with the Satavriya Adi Shirbasti. Her past history revealed normal menstrual history and no any chronic illness, any infection, or any relevant family history. Her obstetric history gives LMP 8 Jan 2021 and expected delivery date is 15 October 2021. Her routine blood investigation was suggestive no any infection and in normal ranges. Her ultrasonography at 32 week 4 days suggestive of IUCR with abdominal circumference corresponding to 27 week 6 days, and fetal weight is 1.4 kg. Here is ultrasonographic parameter comparison with standard parameter, which shows FL-AC ratio is 23.15, which is suggestive of IUCR. Now, fundal height 28-29 weeks with cephalic presentation, normal fetal heart sounds. Her symphysis fundal height is 29 centimeter and AC is 96 centimeter. Here, 3 centimeter of 3 week gap is found between symphysis fundal height and period of gestation, which is suggestive of mild IUCR. So we give her Stavri Adi Shirbasti, which contains Gogrit, Madhu, Kalk, of Shatava, Quath of Satavri and Madhuyashti, Godugd, and after giving Basti in Sims position, patient advised to retain Basti up to maximum time, and after Basti Pratyagaman ka, that is 35 to 40 minutes, she advised take diet rich of grit, milk, rice and sarkara. Thus we gave her 3 Shir Basti on alternative days. After and also advise her diet protocol and for further time. After every 15 days, the patient was followed up, and at every ANC visit, her symphysis fundal height was increased. And at age of 37 weeks, 3 days, we again go to for ultrasonography, which is suggestive of increased fetal weight, and her FL-AC ratio comes to towards normal. That is, we can say that IUCR is mildly relieved. Yeah, it is not suggestive of IUCR. Now, she gave a full-term female child at a gestation age of 40 weeks with fetal weight 29 kg, and her Apgar score was also in normal range. Thus, we can say that in this case, patient with IUCR comes to us and her fundal height was lagging. But with Shir Basti, after treatment, her fundal height was continuously increased, and her growth retardation was furthermore not comes, and fetal distress was also, we also manage the fetal distress. Now, probable mode of action is we used hair Brahman therapy, Shir Basti and Medhan, which is also described by Acharya Shushrut for in the treatment of Garbh sauce, and Shir Sarpi and Madhur Osad Shir Grit in 7 months of Garbhini Paricharya. Thus, all content of the Shir Basti predominantly are Madhur Ras, Snigdh, Sheet, Guru Gan, Sheet Virya, Madhur Vipak, and Prithvi Aap Mahabhut. Thus, due to Madhur Gun and Brahmaniya Gun, all these content are responsible for Vat Saman and Ras Vriddhi. Thus, the Samprapti Vigatan was done because Vat Vriddhi and improper nutrition was main positive factor. Thus, by Shir Basti, we got a good fetal weight at the term. Thus, using Ayurveda, we can make a safer approach in rectifying intrauterine growth restriction of fetus. Thank you.
Thank you, madam. Thank you, Renu Yadav. Next presentation, Dr. Kajal Modhavi. Dr. Kajal Modhavi.
Hi,
Dr.
ma'am.
Mayur Mukunda.
तीन नंबर की तैयार होती है
I'm here.
Dr. Renu Yadav. Please stop your sharing.
Yes, ma'am.
Dr. Mayur Mukunda, are you here?
Yes, ma'am. Yes,
Hello.
ma'am. I'm here. Am I audible?
Okay, you start your presentation. Please be ready, Prajakta Vaidya. For next
Ma'am,
presentation.
please, ma'am, will you please stop
Yes,
disabling
I'm
me for
making you
sharing
host.
screen? Yeah.
Please share your presentation.
Yes, ma'am. Shall I start? Hello. Am I audible, ma'am?
Yes, it is sharing. Just wait. Yes, your presentation is visible.
Yeah. Thank you, ma'am. Shall I start, ma'am?
Yes.
Yes. Okay, ma'am. Good afternoon, everybody. Myself, Dr. Mayur Mukund. I'm second year PG scholar in Rog Nidan एवं विकृति विज्ञान at Sumatibai Shah Hadapsar Ayurved Mahavidyalaya. Today's my presentation topic is importance of Tailabindu Pariksha in diagnosis and prognosis of diseases. Okay. Introduction. Ayurveda is a science of holistic life. Nowadays, whole world is looking towards Ayurveda as a successful path to maintain health as well as to treat diseases. Ayurveda has its own and very specific method of understanding anatomy, physiology, or pathology and whole body, and also a vast description in diagnostic method. To diagnose any diseases, one need to examine the patient thoroughly. For examination of patient, Ayurveda has mentioned some pariksha such as Dvivid, Trivid, Ashtavid Pariksha, Dashavid Pariksha. Here in this topic, we are going to study Tailabindu Pariksha, which is a Mutra Pariksha mentioned in Ashtavid Pariksha. Okay. Ashtasthana Pariksha includes Nadi, Malamutra, Jivha, Shabda, Sparsha, Drik, Akruti. Out of all these Pariksha, Mutra Pariksha is one which proves to be an important diagnostic method in assessing and prognosis.
मी कंटेंट शेअर करत पुढच्या समोरच्या
Yog Ratnakar has given special attention to Mutra Pariksha. Tailabindu Pariksha is developed in medieval period. Is method of Mutra Pariksha. Description of this Pariksha is noticed in 17th.
समोरच्या मुलीने बंद नव्हतं केलं ना मग त्यांनी तुला थांबायचं ना.
Someone is please disturbing. Hello. Okay. It is carried out by Pratyaksha Pramana and Anumana Pramana. Tailabindu Pariksha is used in diagnosis and prognosis of diseases with examination of color and appearance and consistency of urine. A special technique for examination of Mutra was developed. For this, patient early morning urine sample should be collected in glass vessel. This should be very closely, carefully examined during sunrise without causing any disturbances. Hence, here we have made an attempt to understand the importance of Ayurvedic Tailabindu Pariksha in diagnosis and prognosis of diseases. Aim to study the importance of Tailabindu Pariksha in diagnosis and prognosis of diseases. Object to study the application of Tailabindu Pariksha in diagnosis and prognosis of diseases. Material and method. As this is a conceptual study, I have studied Samhitas, modern textbook, published articles and information from internet. Time of collection of urine sample for thyroid as per Ayurveda has been described as a proper time. That means it should be around, it should be before sunrise. That should be morning of Ratnakar has suggested that sample should be collected with the Gatikara left in the last yama of night. That is, it should be around 4 o'clock. Where and how to collect the urine sample? Yog Ratnakar has mentioned that it should be collected in a glass vessel, while Vangasena has stated that urine sample should be collected either in glass vessel or bronze vessel. During collection of urine sample, avoid first and last stream collect the midstream of urine, morning urine. Oil to be used, till tail should be used as a used for Tailabindu Pariksha, especially mentioned by in Yogratnakara, whereas some other authors had just mentioned that the word tail. Acharya Sharanga stated that if name of particular oil is not mentioned, then till tail should be used. Quantity of tail to be used. Quantity of tail to be used is one bindu. One bindu is equal to one drop. When to conduct the pariksha? Physician should wake up patient early in the morning around 4 o'clock, should collect the urine sample in clean glass vessel, and the same should be closely and carefully examined during sunrise time. Tailabindu Pariksha Vidhi. So, as I said early, physician should wake up the patient after around 4 o'clock, should be and then collect the morning urine sample. Urine should be collected in such a way that the first and last stream of early morning urine should be avoided and collect the midstream urine. Glass container should be cleaned properly and mark all 8 directions in it. Fill the glass container up up to its brim and wet till urine sample settle. After settling sample in glass vessel, put a drop of oil with the help of Truna Khanda, which is a dropper, from a maximum height of up to 2 inch from the surface. Then oil drop is observed according to the patterns and distribution of oil drop. Diagnosis and prognosis of diseases is then done. The shape of drop indicates dosha and diseases involvement, while the direction indicates the prognosis of disease. This is how Tailabindu Pariksha is conducted. In this picture, we are seeing glass vessel and marks are done, direct direction marks are done. Then that individual is putting drop from a dropper in that vessel which contains urine. So next, observation. Oil drop patterns and distribution on the surface of urine is observed to determine the diagnosis of diseases. Diagnosis of dosha and disease involvement by spreading shapes of tail. So here we are seeing that if a shape of tail drop is like snake, sarpa, what aggravation, which shows that there is a aggravation of vata dosha. Umbrella shape means Chatrakar. It shows the Pitta aggravation, Pearl, Mukta shape, Kapha aggravation, circular, Mandala shape, Vata predominant. Means here we are going Vata predominant. Bubble, Albududa shape, Pitta predominant. Droplet, if the shape of that drop is droplet shape, then it is Kapha dominant. Tail, when we put the drop of tail in urine, if it sinks, that means we directly go to the bottom of that vessel, then it is Sannipata. Next one is Chalni shape, means foolish, it shows that is a foolish dosha. Skull or human being shape is Bhuta dosha. Prognosis of diseases by spreading tail or oil drop. Diseases is considered as asadhya, means which means incurable if the tail directly goes inside and touches the bottom of vessel. Disease is considered as kashtasadhya, difficult to treat if the tail does not spread or motionless. Disease is considered as sadhya, which means curable or easily manageable if the tail quickly spreads over the surface of urine. Prognosis of diseases by spreading tail drop in direction. If the drop goes to east direction, patient gets relief easily. If it goes in a west direction, moves towards west direction, patient attain happy and healthy life. North means Uttara, patient directly cured and become healthy. South, patient will suffer from fever and gradually recover. Northeast, patient will die in a month. Northwest, patient is going to die anyway. Southeast, patient is born to be die. Uh, Southwest, patient is born to be die. Okay, prognosis by spreading the shapes of tail. If the tail creates shapes like shastra, rat, tiger, scorpion, snake, then the patient will die soon. If the shape of tail is seen as four leg, two leg animals, then the patient will die soon. If the tail creates shape of tortoise, buffalo, honeybee, bird, headless human body, astra, khanda, then such patient not survive long and physician should treat the patient as the disease is incurable. If that tail creates shape like Valli, Mudunga, human pot, well, deer, then the disease is Kashtasadya. If the tail creates shapes like fish, then the patient is free of dosha and disease can be treated easily. If oil creates images of swan, lotus, arch, mountain, elephant, camel, tree, then such patient is going to be cured and should be treated aggressively. It has its prognosis. Discussion of this topic. Tailabindu Pariksha is seen to be an old method, but it is time tested and has its own importance in diagnosis and prognosis of patient by the generation of Ayurvedic community. It is based on the consistency, thickness, density of urine and seeing the shape, spreaded oil on the surface of urine. All these changes in the properties of urine as compared to normal are due to the release of various excretory substances in the urine in different diseases. These changes can be assessed by the patterns of Tailabindu Pariksha. The patterns and distribution of oil drop on the urine are then considered to determine the diagnosis and prognosis of diseases. Changes in urine properties such as change in specific gravity, viscosity, surface tension, urine pH level can be assessed by modern methods of urine examination such as urine physical, chemical examination, urine microscopic examination, and then correlate it with the patterns of Tailabindu Pariksha. If this method tested and correlated on the modern parameters, then it can be a gold standard in future. Although it is a very old method, but it proves successfully. Conclusion, Tailabindu Pariksha can be used as a diagnostic and prognostic tool. Tailabindu Mutra Pariksha has an important role in diagnostic and prognostic purpose. This method is a very cost effective and may be proved to be a useful technique in this field. Thank you all of you. These are the references. Thank you all of you.
Thank you, Dr. Mayur.
Thank you, ma'am.
Dr. Kajal, are you here?
Hello. Yes, ma'am.
Dr. Kajal,
Yes, ma'am. I'm here.
share your presentation.
Yes, yes. Hello everyone, I'm Dr. Kajal Modve, PG second year PG student, Steven Shri Vivekananda Nursing Home Trust College, Ravri Factory. My topic is effect of Virechana in the management of Asthenonecroteratozoospermia, that is the Shukra Dushti, a case report. Am I audible?
Yes, you are audible.
Okay, okay. Low sperm count, that is oligozoospermia, reduced mortality of sperm, that is asthenozoospermia, abnormal morphology of sperm, teratozoospermia, and dead sperm, that is a necrozoospermia, are the main causes of male infertility. It is correlated with Shukra Dushti in Ayurveda. According to Ayurveda, to produce healthy progeny, 4 things are necessary, that is Ritu, reproductive age and ovulation period, Kshetra, female reproductive tract, Ambu, nutritional factors, and Beej, that is sperm and ovum. If there is Dushti, disturbance in any one of the above factor, it will lead to infertility. Shukra being on among the 7 dhatus, that is Ras, Rakta, Mans, Med, Asti, Majja, and Shukra. Virechan is one of the Shodhan Chikitsa, cleansing procedure, which is beneficial in relieving the disturbance of dosh and dhatus. Aim to assess the efficacy of Virechan in the management of Asthenonecroteratozoospermia. Materials and methods. The present case study is about a 30 years old male diagnosed with asthenonecroteratozoospermia. Virechana was done according to the classical method, and assessment was done after virechana and after 15 days of follow. Result: the sperm analysis showed an increase of total sperm count from 5 million to 40 million per ml, from 4% abnormal form to 25% normal form. Conclusion: the Virechana procedure has shown an effective and safe method of increasing sperm count, sperm motility, and normal form of sperm. Hence, therapy might be beneficial in patient of asthenonecroteratozoospermia. Introduction: infertility is defined as inability to achieve pregnancy after 1 year of unprotected coitus. Worldwide, more than 70 million couples suffer from infertility, and the majority of these reside in developing countries. Male infertility may be contributing to total infertility in large. Recent studies have indicated that the prevalence of oligozoospermia is extremely high in metropolis as well as in smaller towns of India. Male subinfertility can be the result of congenital urogenital anomaly, infection of the testes or tract, increased scrotal temperature, endocrine disturbance, genetic abnormalities, and immunological factors. However, idiopathic male subinfertility is found in 30 to 75% of cases, except some physical and the rest case genetic often result in decreased number of spermatozoa. Oligozoospermia. There is mortality, astenozoospermia, many abnormalities on morphology. Teratozoospermia. These abnormalities usually are described as the asthenonecroteratozoospermia syndrome. Acharya Charak has mentioned various etiological factors for Shukra dosh or Shukra dushti as abnormal or decreased sperm count in Charak. Acharya Kashyap file describing the concept of Virech Falashruti effect of the procedure mentioned that sperm becomes mobile is due to Virech. Hence, the present study is of assist in management. A 30-year-old diagnosed with and attended the OPD of Shri and Prasuti with his analysis report and complaint of conceived since last 4 years. Their active marriage life was 5 years. His analysis report showed only few sperm count and 70 to 80% non-motile sperm, while semen quantity was sufficient. He had no major illness in past, no any drug history or family history related. The patient was diagnosed as asthenonecroteratozoospermia and Shukra dushti as Ayurveda on the basis of analysis. Was counsel and explained about Virechana karma and was admitted in IPD of Panchkarma. First Dipan Pachan, that is Shankavati, twice a day, and Avipatikar Chura, 10 HS with lukewarm water given for 5 days. The Dipan. Then first which very good given lukewarm water. Anupa is a lukewarm and Sveta with tail for 2 days, and karma is done with Trivritta Avyaha and Erandate. Anupa method number 1. Then yoga was administered. Analysis treatment after Virechana karma and after 15 days of follow after 15 days of karma. Restrictions regarding that is bitter, sore, and salt were avoided. Especially that is Peya, Vilpi, Munda, and AYUSH. Then physical examination of semen. Consistency and liquefaction, that is 20 minutes. Effect on total sperm count on semen analysis. Before treatment, the sperms 5 millions per ml. After Virechana Karma, that is a 40 million, and after 15 days of follow, the count was 62 millions. The mortality is increased from 10% to 30%, and in follow-up, that is a 40%. Sluggishly progressive mortality from 0% to 40%. Then non-progressive sperm from before treatment, it was 20%. Then after follow-up, 30%. Immotile sperm before treatment, 100%. That was after treatment, 20% and 15%. Head defect before treatment, 8%. After first follow-up, 5%, and after 15 days of 3%. Body defect, 8%. That was 6 and 2%. Tail defect before treatment, it was 9%. Then after Virechana Karma, it was 3%, and after follow-up, 2%. Observations and results. There was no difference found in physical examination, that is consistency, volume, and liquefaction time in semen analysis. There was significant increase found in total spermatozoa, that is 60 million after Virechana and 62 million after follow. Major positive difference was found in mortality of sperm, that is a rapidly progressive sperm, 30% after Virechana and 40% at follow period. And immotile sperms showed 20% after Virechana and 15% at follow period, which are 100% immotile before treatment. Discussion and conclusion. To produce progeny, 4 things necessary, that is Ritu, Kshetra, Ambu, Beej, and presence of any Dushti is the above factor will lead into a Shukra Dushti, which is the prime cause of infertility. Oligoostenozoospermia is one of the most prevalent reason for male infertility in clinical practice. In most of the cases, functional deformity in spermatogenesis is the major reason for the oligoostenozoospermia, which involves either defective mechanism of testosterone or excess production of reactive oxygen specimen, or both. Acharya Sushruta has included Sheena Shukra, that is oligozoospermia, under Shukra Dushti. Here, Vat dosh along with Pitta undergo vitiation and does disturbance in the normal qualities and quantity of a Shukra Dhatu. As a result of this, Shukravaha Srotots undergo Dushti, which deliberate one normal individual from impregnating his life partner, ending in infertility. Virechana might have effect in Vadi Viparit Chikitsa. Acharya have given a list of various disease conditions, Virecha Vadi, where Virechana Karma is ideal to administer as a prior choice of therapy. Reto Dosha is one among the Virecha Vadis. Samyak Virechana contributes in. Acharya Kashyap has mainly highlighted the role of Virechana on Shukra Dhatu. According to him, by the action of Virechana, the function of Shukra increases. Shukra becomes more active. The whole process helps to remove the free radicals, oxidants present in the microcirculatory channels of Shukravah Srotas, which interfere with the function of Shukra, and by doing so increases the activity of Shukra. Each and every Sanshodhan drug has its own target. Draksha is Virechanopak, adjuvant drug of in Virechan Dravya. It enhances the potency of chief Virechan drug and nullifies its adverse action. It has properties like Madhur Ras, Madhur Vipak, Shit Virya, Vat Pitta, Shamak Doshagnata, and Vrishya Karma. There is Vat Pitta involvement in Shukra Dushti. Shukra is Jal Mahabhut, that is water element dominant. So in order to increase Shukra, one has to decrease the Agni Mahabhut, fire element, which can be possible through removing vitiated Pitta Dosha. Virechana is useful for eliminating vitiated Pitta dosh, active transformation of Srotas, and most desirable Shukra procure. This process helps to remove free radicals or oxidants which present in microcirculatory channels of semen pathway and increase the motility of sperm. Panchkarma is an important treatment protocol in Ayurveda. Virechana is an important Shodhan Chikitsa for vitiated Pitta dosha. Through Shodhan, Srotodushti, clearing of channels can be accomplished. The present case study highlights the efficacy of Virechana Karma, and a study on large sample will be a significant statistical result. Thank you.
Thank you, madam.
Thank you.
Thank you, Dr. Kajal.
Thank you, ma'am.
Dr. Srija Venugopal. Dr. Prajakta is here.
Yes, ma'am.
Dr. Prajakta, wait.
Yes, ma'am. Yes.
Dr. Srija Venugopal. Dr. Srija Venugopal, are you here? Dr. Vaishali Arti. Dr. Vaishali Arti. Dr. Vaishali Atri.
Ma'am, may I share now?
Dr. Shraddha Bhuvar. Dr. Prajakta, are you here?
Yes,
Yes,
ma'am. I'm here. Prajakta. Dr. Prajakta.
Dr. Prajakta Vaidya.
Yes, ma'am.
Your voice is not audible.
Yes, ma'am.
Please share your screen.
Am I audible, ma'am?
Yes, you are audible.
Hello and good afternoon, everyone. Myself, Vaidya Prajakta Vaidya, PG scholar from Sahita Siddhanta Department, CSMSS Ayurved Mahavidyalaya, Kanchanwadi, Aurangabad. I'm starting with my topic, presenting a topic namely Ahar Shuddho Sattva Shuddhi under the guidance of Dr. Neeta Madam. It's a review on association of Ahara with mental health. In Ayurveda, the health is defined at spiritual level as prasanna atmendriya manaha. It is equilibrium and harmony in atma, indriya and mana. Sharira is defined as chetanadhisthana bhutam, where chetana means soul along with the mind resides. So body, mind and soul are interdependent, inseparable entities. The things which affect the body makes changes mental status too. So the food also. We become what we eat, physically and mentally. Aims and objectives of my studies are to review the concept of ahara and its association with mental health, and also to explore the importance of nutrition and diet in the maintenance of mental health. To know the association, we will quickly review three things: ahara, mana, and poshan. These are the material and method that I have used. Aryate iti ahara. Whatever is solid is ahara. So drugs are also included in ahara. It is also called Mahabheshaj in Kashyap Samhita, Brahma in Upanishad.
Dr. Prajakta?
Yes, ma'am. Yes, ma'am.
The slides are not moving. Those are not visible.
Ma'am, okay, I will share it again.
And your voice is also, it is very low.
Okay. Okay, I will try once, ma'am.
ऑडिबल आहे का बघा
तिला ऐकू जाते आपला
Now, ma'am, slides are moving.
Not yet, ma'am.
I'm moving now.
Please once stop share and again share it.
Okay. Ma'am, is it moving now?
It is visible now.
Moving or not, ma'am?
No, you have to do it full screen.
I have did it, but okay, I will share it. Ma'am, voice is clear now?
Yes, your voice is clear.
Is it moving now, ma'am?
Go for next slide.
Go to your next slide.
Go for next slide.
Now, ma'am?
Yeah. Okay.
Sorry, it's something wrong in this.
Ashta, go for aim and objective.
Okay. The slides are not moving. There's problems. Okay.
Go for post aims and objects.
Aims and objects, yes. Sorry. Aims and objective of my study are to review the concept of ahara and its association with mental health, to explore the importance of nutrition and diet in the maintenance of mental health. To know this association, we will quickly review in three things, that is ahara, mana, and poshana. This is a methodology that I have used. I have used Charak Samhita, Sushruta Samhita, and the reference from Chandogya Upanishad, Bhagavad Gita, and also the reference from various websites were connected. Ahara. Aryate iti ahara. Whatever swallowed is ahara. So the drug are also included in ahara. It is also called as a Mahabheshajya in Kashyap Samhita, Brahma as a Upanishad, and in Trayopastambha, namely Ahara, Nidra, and Brahmacharya, Ahara has been mentioned first. Let food be the medicine, food-mood connection. No health without mental health shows its importance, where the mental health and food is associated. Mind, manya. Sattva is said to be highest and it is called guna. Sattva is prakashak guna, which brings positivity, harmony. Rajas represent active and intense mind. Tamas is opposite of sattva. Tama means andhakar or making avarana. These three qualities are present in almost everything, including food. Now let's see what is poshana or nutrition. Nutrition is a gross term. When we say nutrition, body nourishment comes first in the mind. But what about mind? Yes, mind also needs nourishment. Sharira, it includes body and mind. So, Sharira Poshana includes body and mind nourishment too. Mind nourishment can be understood in the two forms: thoughts and good food. Good thoughts depend on positive mind attitude, and good food, which further depends on two things: what kind of food we eat and how we eat the food. What kind of food we eat? Here comes the role of Satvik Ahar mentioned in Bhagavad Gita. Chaturvidha Ahar, Shadrasatmaka Ahar mentioned in Ayurvedic text. How we eat is explained by Charak as Ahar Vidhi Vidhan. To understand the association of mind with food, it is said in Chandogya Upanishad that food, when eaten, becomes threefold. Yah stavishto dhatu tat purisham. Yo madhyama ma sambhavati. And yo anvishtam, what is subtle, becomes mind. Here, food is not converted into mind, but when we eat food, mind is pleased by appetite. So, from this, it is clear we become what we eat, physically and mentally too. So, what to eat is very important. Let's see what to eat. If we consume satvika ahara, our man becomes satvika. Sattvic food will help you to calm your body, mind, and rajasic food, where tamasic food also generate toxicating vibes in your body. Chaturvidha ahara, ashita khadita pita lead. It is chewable, eatable, drinkable, and leakable foods. Shadrasatmak ahar. Sarva rasabhyaso bala karanam. So, it is advised to take Shadrasatmak ahar, which present in Ashit Khaditadi 4 food forms, which were discussed earlier. Ahar Vidhi Vidhan are the guidelines to gain the optimum benefit from consumed food, which is mentioned by Char. So, from this, it is said in Ayurveda, the person having Alpasattva are more prone to have diseases, as Alpasattva indulges Pradnyaparad, and Pradnyaparad is the root cause of all kind of illnesses. Therefore, one should always try to increase the Sattva guna. Sattva means pure, Sattva also means mind, and Sattva Shuddhi is purity of mind, the healthy and disease-free state internally. So for healthy life, it is important to achieve Sattva Shuddhi, and to achieve Sattva Shuddhi, Ahar Shuddhi is important, which is rightly said in Chandogya Upanishad. Ahar Shuddho, Sattva Shuddhi, Sattva Shuddho, Dhruva Smriti, Smriti Landhe Sarva Granthi Nam Vipramokshaha. From purity of mind comes from purity of food comes purity of mind. From purity of mind comes constant remembrance of God, and from there, one can be liberated. Lastly, you are what you eat, so don't be fast, cheap, easy, or fake. It is so said by unknown person, but very rightly said. Thank you. Thank you so much.
Thank you, Doctor. Dr. Prajakta, thank you.
Thank you.
Dr. Srija Venugopal, are you here?
Yes.
Dr. Srija Venugopal?
Yes, I'm here.
Okay, share your PPT.
Okay. Good afternoon, all.
Yes.
Okay, today I'm going to present my paper on a conceptual review of Garbhasthapana drugs in Ayurveda. Ayurveda, we know all that it is the eternal science, and our Ayurveda consider women's health prior, and it consider health of mother considerably affects the future of generation also. It is estimated that almost 15.6 spontaneous abortions are taking place in India every year. This can be prevented by using proper Garbhasthapana drugs. In our Samhitas, according to Charaga, Kashyapa, all are mentioned so many Garbhasthapana, Prajasthapana drugs. In this study, I am reviewing that Garbhasthapana drugs from our Samhitas. First of all, what is meant by Garbhasthapana drugs? Those drugs helps in stabilizing the fetus and maintenance of pregnancy are called Garbhasthapana drugs. Its synonym is Prajasthapana drug. My aims of my study is to study Garbhasthapana drugs according to various Ayurvedic Samhitas and to analyze each and every drug in Garbhasthapana Ganas, to study the property of each and every drug in detail. Material and methods. This is a literary study based on review of Garbhasthapana drugs according to various Samhitas. All materials are collected accordingly from respective Samhitas. Detailed study of each and every drug was done with the help of various Nikandus and various textbooks of Dravya Guna Vijnana. Properties of each drug is analyzed by tabulating all available information. Then literature review. According to Charaga, Charaga enlisted Prajasthapana Kashayas in Sutrasthana 4th chapter and also enlisted the same drugs in Sharirasthana 8th chapter also. Here I am tabulating that 10 drugs in Prajasthapana Kwadagana. The drugs are Aindri, Brahmi, Shadavirya, Then Sahasravirya, Shatavirya, Amokha, Avyata, Shiva. Shiva means Haritaki. Then Vishwakranta, Vatti Pushpi and Kadali. These are all the drugs. Actually, Avyada Charaka mentioned to take either Guduji, Amalaki or Kadali. So I mentioned all drugs in this tableting form. Here I compare the Rasa Guna Virya Vipaka Doshaknada properties of all drugs as tablated. Majority of these drugs are Kapha, Pitta, Hara, so they can regulate our recta and maintain our Garbhashya strength also. Then these drugs are mentioned under Kashaya Ganas, and so we can use these as decoctions. These drugs are also used as amulets and for tying in wrist or arm. Milk or ghee prepared using these herbs should be used for drinking. Then processed water or cold decoction can be used for bathing during Pushya Nakshatra. Then above mentioned drugs should be kept in close contact with the pregnant lady too. Then Prajastabhana drugs according to Kashyapa. He mentioned a variety of drugs as Prajastabhana drugs. He indicate to tie as amulets in wrist and arms. The drugs are Bahupatra, it is Bhumi Amalaki, then Ananta, Sharipa, Ishwari, Mudita, then Brahmi, Indravaruni, Sahadevi, Jivaka, Vrishabhaka, Bharni, Samanga, Rohapada, Vadashunga, Atmagupta, Arishta, Putana, Keshi, Shadavirya, Sahasravirya. Now, these drugs are tableted here, and I compared its properties also, Rasa, Guna, Virya, Vipaga, and Prabhava karmas of all drugs. Then these drugs can be used for getting strength to Garbhashya and also to prevent spontaneous abortions by it helps to improve our strength of Shonita. It decreases Pitta and can avoid fetal abnormalities too. Most of the drugs in Prajastabhana Gana are having various systemic Rogagnada properties too. They can be used for treating Prameha, Vatarekta, Jwara, liver diseases, etc. So this can be help in maintaining pregnancy too. Therapeutic abortions contributed by these Prajastabhana drugs is helpful one or in another way. And that can be easily understood from above tables. And thus we can infer that drugs mentioned by our acharyas are having immense capacities. Then according to my study, I got the result like that I tabulated here. For organ abnormalities like of uterus, cervix, etc., we can provide Guduji, Durva, Vatti Pushpi, Haritaki, like that drugs, because they can help in correcting our Mamsa Dadu, because it is the Dadu that our uterus is formed due to that smooth muscles. It can correct the strength of the smooth muscle. Then next, expulsion of premature features or bleeding tendency can be prevented by Vatya Pushpi, Priyanku, Durva, Kadali, Guduji, etc. It can prevent Shonidadi Pravarti, then Rektaskandana, Rektagada, Pittavada Shamana also these drugs are. Then third category, fetal organ malformation can be prevented by Durva, Guduji, Kaduki, Haritaki, etc. They can correct the circulatory problems, particularly Rasa, Rekta, Dadu, Gada problems. Then by correcting recta, they can prevent fetal deformalities too. Then next category, deep-rooted disease pathology in mother's body. This can be prevented by Kushta. The disease Kushta can be prevented by Brahmi and Guduji. Rekta Pitta can be prevented by Durva, Padala, etc. Vadaretta can be prevented by Brahmi, Kuduji, Haritaki. Then Prameha can be prevented by Brahmi, Kadugi, etc. Thus, these Prajastabhana drugs can prevent abortions, then fetal deformalities, etc. Then actions of Prajastabhana drugs. Our acharyas have stated the actions of Prajastabhana drugs as that which removes all the abnormalities in the pregnant lady's body, which cause obstacles in the conception or that create fetal abnormalities or abortion. According to Charaga, Garbhakara bhavas are the ideal factors required for the birth of an ideal baby. Any abnormalities or defects in this may lead to problems in conception or maintenance of pregnancy. Also, Garbhopagatakara bhavas mentioned by other acharyas also denotes that the factors that affect the conception or sustenance of the pregnancy. So both of these bhavas may be problems in Prajastabhana action. Those problems may include structural and functional abnormalities in organs related to conception and female gametes. Ahita aharas and ahita ajaras of mother is also a main cause for these. The main problems that may occur as part of Prajastabhana may be failure to conceive or sustenance of pregnancy due to either intrauterine death of fetus or its expulsion before viability in the form of miscarriages and abortions, etc. Overall review of quality and action of individual drug in Prajastabhana Gana gives us inference that these drugs are acting in different angles like Rasa, Guna, Virya, Vipaka and Prabhava. And the drugs referred here are not similar in every aspect with its Rasa Panchaga. So it indicates that the procreation of healthy, desirable child is carried out by the special therapeutic properties or by Prabhava. In conclusion, Charagokta Mahakashayas and Prajastamana drugs by Kashyapa are certain unique drugs arranged in an excellent classification technique. Overall, the Prajastabhana drugs have a Tikta Rasa predominance with Lagu Guna, Shita Virya and Madhura Vipaga. As a whole group, these drugs balances Tridoshas through their balanced actions and they overcome potentially the structural and functional obstacles in the process of Prajastabhana in female body. These drugs execute their actions mainly through maintaining erect dhatu as well as by maintaining the healthy status of our consumption related organs. As modern medical field is unaware about this kind of unique knowledge and approach in traditional and contemporary science, initially much obstacles may be faced to scientifically prove and impose such classical ideas in public. So, good research works are to be carried in association with genetic engineering or through chromosomal studies for exploration of newer factors regarding such medicines. Probably, many of the spontaneous abortions, genetic disorders, or parental carrying diseases can be tackled by such medicaments or herbal formulations. It may prove maternal as well as fetal health too. It may be a boon for our coming babies and our world too. It may remain as a noble thought for the mankind, which may even give the Nobel Award to our researchers too. Thank you.
Thank you, Dr. Srija. Thank you very much. Dr. Vaishali Atri.
Yes, ma'am.
Share your presentation. Dr. Vaishali. Dr. Shraddha Bhuvad, please be ready for the next presentation. Dr. Kiran Sinha, Dr. K. Thailavati.
Can I start, ma'am, presentation?
Yes, sure.
Good afternoon, everyone. My today topic of presentation is clinical study to evaluate the effect of Pratimoshanasya with Shatabdi Grit in PCOS. And myself, Dr. Vaishali Atri from Department of Panchkarma from Honorable Shri Annasaheb Dange, Ayurved Medical College, Postgraduate and Research Center, Ashta. So here are the topics we will be discussing in our today presentation. That is, what is PCOS, Ayurveda perspective of PCOS, aim and objectives of our clinical study, and what is Pratimashnasya and how it affects on PCOS. So what is PCOS? PCOS is an endocrinal disorder which almost 1 to 5 females in all the India are facing between 18 to 54 years of age are affected by PCOS. It varies from 2.2 to 26% globally. Student studies done in South India and Maharashtra, prevalence were reported as 9.3% and 22.5% respectively. So, what are the symptoms of PCOS? Excessive body hair or facial hair, irregularity in menstrual bleeding, and polycystic ovaries are some of the symptoms of PCOS. So, what Ayurveda view on PCOS? PCOS can be correlated with the Artavshai. That is, in this disease, an insufficient Artav, that is, the menstrual period, doesn't appear at the appropriate time, flow is scanty, and doesn't last for 3 days. It is also associated with vaginal discomfort. So here's the research question, that is Pratimashnasya effective in the management of PCOS? So what is these are the research gap, that is in some of the thesis like a comparative clinical study to evaluate the efficacy of Shatapushpa Tel Pratimashnasya and Shatavrigrat Pratimashnasya in Vifal Arthav to induce ovulation was done previously. Now aim. To evaluate the efficacy of Pratimashnasya with Shatavrigrat in the management of a PCOS is at the aim of our study, and the objectives are to study the PCOS, to study the Artavshai, and to study about Pratimashnasya. Now, this is our research methodology. In this study setting, that is open clinical trial, we have taken 10 patients from the OPD of Department of Panchkarma, Dhanvantri Hospital, Ashta, and we have given a treatment plan, that is Pratimashnasya with Shatavrigrat for 21 days for consecutive 3 cycles, that is 6th day of the menstrual cycle, and dose will be 2 drops in each nostrils by 2 times, that is morning and evening, and the follow-up is recommended for the 6th day of each 3rd day cycle of each 3 cycle and 1st day of the 4th cycle. Now, material used in our study. Shatavrigrat. Shatavari has thousands of qualities. Some guna of Shatavari, according to Acharya Kashyap, from Adhyaya Shatapushpa Shatavari Adhyaya, Shlok 7 to 8 are, that is, it is Sheath and has Kashaya Madhurat. Snigdha Vrishya does the Rasayan Karm, helps in the mitigation of Vata and Pitta, provides relief from constipation, it increases Vand, Oj, Bal, Smriti, Medha, and Buddhi. Also, it produces Pushpa, that is, menstrual cycle, and gives the fertility, and it eliminates Bhuta, Papa, and Shap. So, operational definition, that is, what is Nasya and what is Pratimashnasya? Nasya is the medication, is a type of a Panchkarma procedure in which the medication is installed through the nose and the drugs administered through the nose reach the brain and eliminate the morbid doshas responsible for the disease and cure the disease. And Pratimashnasya is actually a type of an asya in which is Shigrakari, and when it comes to the guna, it is stretched. From a Janma Marana like Basti, it can be given anytime. It has very less complication, and there is no rule to follow any pathe, and there is no threat of Akshi Stabdata. So the inclusion criteria of our study is patient with a confirmed diagnosis of a PCOS, the subjects who are willing to participate in our study, and the patients suffering from clinical sign of PCOS like an abnormality in menstrual bleeding, scanty bleeding, or irregular bleeding, and the female patients with age 18 to 35 years. Now, exclusion criteria. Congenital patient of having congenital abnormalities of reproductive organs, patient with hypothyroidism or hyperthyroidism, patients who are not willing to take a Nasya, and pregnant and lactating women. Assessment criteria is duration of a bleeding, irregular bleeding, number of pads per cycle, pain during menstruation, and general weakness. We have criteria in the 0, 1, 2, and 3. That is duration of a bleeding. If that is 3 to 5 days, then we said it is a 0 grade. Then 1 to 2 days, we said it is 1 day, 2 spotting, then 3 days. That's how we classify all the 4 parameters in 0, 1, 2, and 3 grade. Now, what happens in actual study? Result of a study trial. So here are the results of 10 patients who got Pratimoshnasya daily for 3 consecutive cycles. Out of 10 patients, 6 patients shows results, means after 3 consecutive cycles, their periods got regular and all other symptoms subsided, like the amount of a bleeding is normal, the weakness and the pain also subsided. And 2 patients means their periods got regular, but the duration of menstrual bleeding is less than 3 days. And 1 patient shows good result, depicts her period got regular, but the bleeding is less than 3 days and it is also associated with the pain. Now, whereas 1 patient shows no relief. This is our graph. This is our pie chart that is shows excellent 60%, very good 20%, good 10%, and no relief in 10%. Now, here's our discussion. In PCOS, hormonal imbalance is one of the factors that contribute to the irregularity of the menstrual cycle, and with the help of a Pratimoshnasya, it shows an immediate effect on stimulating the hypothalamus, which in turn activates the pituitary gland and stimulates our ovaries. Further, this action corrects whole HPO excess and secretes the hormones in a balanced manner, which helps in the regular menstruation. And now, if we see the pharmaceutical action of a Shatavari, that is, Shatavari too have a Vat Shama Guna, which clean and nourishes the throatus, and it does the Rasayan Karm, which also relaxes the body and the mind, which in turn helps in the regular menstruation. Also, as per reference of Acharya Kashyap, Nitya Nasya, that is, Pratimash Nasya, which Shatavari Grit helps in the correction of Arthav doshas. So, here are 4 conclusions of our study. First, polycystic ovarian syndrome is an endocrine disorder with complex condition. There is a need for multimodal approach to treat PCOS, and for sure Pratimoshnasya will help in it. And Shatavari with Pratimoshnasya shows a good effect on maintaining the irregular menstrual cycles and also nourishes the overall body and helps in increasing the immunity, slows down the stress. So overall helps in the healthy lifestyle. So this study has given a very cost effective yet easy to administer at home for patient, as there is no need to come regularly to a hospital for a Pratimoshnasya. So here are some references, and thank you.
Thank you, Dr. Thank you, Vaishali.
Yes, ma'am. Thank you.
Was actually the presentation that you have given. Dr. Shraddha, are you here?
Yes, ma'am.
Share your presentation, please. Dr. Shraddha, who are?
Yes.
Dr. Karan Sinha, are you here?
Hello.
Yes, ma'am. Hello.
Hello.
Yes, ma'am.
Dr. Kiran, please be ready.
Okay, ma'am.
Dr. K. Thalavati, Dr. Varsha Gaikwad, and Dr. Divya Ramgude. Please be ready for the next presentations. Dr. Shraddha, share your screen, please.
My screen is visible?
No, not yet. Dr. Shraddha? Dr. Kiran?
हाँ मैम,
Are
हाँ
you
मैम,
there?
wait मैम, wait.
Your voice is also low. I can't hear you. डॉक्टर किरण से हाँ श्रद्धा ने केलं.
Hello.
Yes,
Hello.
Shraddha, Dr. Shraddha.
हाँ मैम,
Start your
my screen
presentation.
is visible.
Yes, it is
Hello.
visible.
Okay ma'am, thank you. Hello, namaste respected sir and ma'am. My name is Shraddha Bhuvat. Today's my presentation topic is Ayurvedic management of Eka Kushta by Shavan Chikitsa under guidance of Vaidya Anaya Patrikar ma'am and Vaidya Hemant Paradkar sir. Next slide. Introduction. In 20th century, changing living style of persons, improper dietary habits, irregular lifestyles, disturbed sleep pattern, stress can lead to imbalance of doshas, which can cause disease like psoriasis. Skin is the largest organ as well as 5 sense organs in human. It covers whole body. Imbalance in the body may be reflected on skin. Ayurveda all types of skin disease under Kushta. In Charak Samhita, egg Kushta is described as Vata Kapha disease. In present study, psoriasis has been taken as egg Kushta. Clinical feature of egg Kushta described by Acharya Charak are very much similar to that of psoriasis. The number of people suffering from psoriasis all over the world is increasing progressively. Successful management of psoriasis patients depends on clinicians' understanding of the various treatment options as well as their recognition is associated adverse reaction. In Ayurveda, Kushta Rog is also considered as Papakarma Vyadi. Here, my case study: a 45 years male patient comes in our hospital at APM's Ayurved Mahavidyalaya, Science, Mumbai for Ayurvedic treatment. Symptoms are: first, blackish discoloration on hand and abdomen; second, severe itching; third, dryness; fourth, swelling on face; fifth, scaling on skin since 2 months. History of present illness: patient has no skin problem before 2 months. Then he started to have reddish patches on hand and abdomen, scaling on skin and itching. Patient had taken allopathic treatment. He got relief, but after few days, patient had recurrence in symptoms. अष्टविध परीक्षा: नाडी, पित्त कफज, मल सम्यक 1 times per day, मूत्र सम्यक 4 to 5 times per day, जिह्वा साम, शब्द प्राकृत, स्पर्श शीत, दृक रक्त वर्णीय, आकृती कृश. Local examination: severe dryness on both hands, second, scaling present on hand, both hand and redness present on face. Next slide. निदान पंचक: हेतु दिवास्वाप 3 to 4 times in a week, stress, Shitajal Snan daily, alcohol consumption 3 to 4 times in a week, Shitambu Sevan, extra salt, fish 3 times in a week, Purvarup, itching and dryness on skin, Rup, blackish discoloration on skin and scaling formation. Fifth, Anupashay, increase in cold season. Next slide. Samprapti, after Hetu 7, vitiated 3 doshas, Vat, Pitta and Kapha, along with impaired Tvak, Rakta, Mausa, Ambu. Kleda Utpatti, then severe dryness with scaling formation and redness on face and Eka Kushta. Material and method: types of study, single case study, authorized Ayurvedic classical texts were used as a source of material like Charak Samhita and Sushruta Samhita. Next, here treatment given: Ampachal, second Abhyantar Snehapan, third Mrudu Virechan, fourth Krimigna Chikitsa, fifth Mrudu Abhyanga, sixth lifestyle modification, and seventh change dietary habits. Treatment medications: first Gandhak Rasayan, dose 250 mg thrice a day. Second Arogyavardhini Vati, dose 250 mg twice a day. Third Avipattikar Churna, dose 5 mg at a bedtime. Fourth Mahatikta Gritapan, dose 10 ml, duration empty stomach at early morning. Fifth, Krumikuthar Ras, dose 250 mg at a bedtime. 6 karanja tel for local application. Here, pathya, ahar, avoid alcohol consumption, shita ambu sevan, fish and excessive salt. Vihar, avoid shita jalasnan and divasva. Next slide. Here result according to the grading scale. First, itching before treatment severe, after treatment absent. Second, color change before treatment blackish discoloration, after treatment normal skin color. Third, scaling formation before treatment severe, after treatment mild. Fourth, dryness before treatment severe, after treatment mild. Fifth, inflammation before treatment severe, after treatment mild. Here, case from day 1 to day 21. From day 1, redness on face and scaling formation. At day 21, absent redness on face and scaling formation. Conclusion, Ayurvedic treatment showed very excellent result in psoriasis patient, decreased signs and symptoms of disease. Arogyavardhini Vatti acts as Sarva Kushta Vinashini and according to Charak Samhita, Vatottereshu Sarpipana, Mahatikta is a Siddha Ghrita. It has Kushtagna properties. In this case study, we found significant result in signs and symptoms with Mridu Virechar followed by Sanshaman Aushadhi. Internal medication can be better option for management of psoriasis. Discussion, Gandhak Rasayan acts as a Kushtagna, Kandugna, Raktashodhak, Pranaropak, Tvacha, Krumigna. It is mainly indicated in Kushtharog. It reduces the itching and infection. Beneficial for skin complexion. Second, Arogyavardhini Vatti. Arogyavardhini Vatti is a Kafagna and Kleda Shodhan. It enhances Twak properties. Gugu and Shilajatu forming Kajjali Kalpa. It is Kafa and Kledanashak. Trifala is Kledanashak and Kafanashak. Kadunimba is Kafa, Kushtagna, very useful in all types of Kushta. Avipattikar Churna gives laxative properties by purifying bile, acts as a Pitta Virechak, and Pitta and Rakta are Ashra Bhav. That's why we use in Kushta. Mahatikta Gritapan. Mahatikta Grita, which is prepared with drugs having their properties like Dipan, Pachan, Rakta Prasadan, Rakta Shodhan, Kandugna, Kushtagna, Varne. As per the classical references, it has the special indication Kushthavikar. Krumikuttharas, it is an effective Ayurvedic medicine useful in treating intestinal worm. As per Acharya Sushrut, all Kushta are Tridoshaj and Krumit, hence used in Kushta. Karanja tel oil is very useful in skin problems like itching. Thank you.
Hello.
Hello.
Thank you, Shraddha.
Thank you, ma'am.
Thank you. Dr. Kiran, are you here?
Yes, ma'am. Hello.
Please
Am I
share your
audible?
presentation.
Okay, ma'am. Is my slide audible, visible? Hello? Hello?
Yes, madam, proceed.
Hello?
Yes, proceed.
Is it visible, my slide?
Yeah. Share the slides.
It's not 1 minute. Sorry for the inconvenience. Yeah. Can I present?
Share your PPT, madam.
Yes, I have shared the screen. Isn't it visible?
It is not visible yet.
Okay, I'll try again.
It is not visible. Please share your presentation first.
Yes, ma'am. Yes, ma'am. Is it visible now?
Yes, now it is visible. You can start your
Okay, ma'am.
presentation.
Thank you. Yes, ma'am. Very good afternoon to all the delegates and members. Myself, Dr. Kiran Shankar Singh, PG Scholar, PTSR Department, GSU Usmanabad. I'm going to present a case study on Ayurvedic management of Kapha Yoni Vyapat under the guidance of Dr. Veena Patil, ma'am, HOD and professor in PTSR Department, Government Ayurved College, Usmanabad. This is a case with a patient with age 23 years, occupation. She works in a father's garment shop, which is mostly a sitting work. She was admitted on 21st January 2021. Chief complaints are Yonigat Shvetasrav, which was on and off since 6 months, Yoni Pradeshi Kandu, which was on and off since 6 months, along with Adyodar Shul and Kati Shul. History of present illness. The patient came to our OPD with a complaint of recurrent vaginal white discharge and vulvovaginal pruritus since 6 months. Before which, 7 months back, she had a missed abortion and for which she had undergone dilatation and curettage. And in last 6 months, she had 4 episodes of the symptoms for which she had taken allopathic treatment but only got symptomatic and temporary relief. And since last 2 months, she is having mild lower abdominal pain and lower backache. Both of these complaints subside after taking painkillers. So she came to a hospital to find a permanent and a long-term treatment. In a previous history of previous illness, there was nothing specific. In drug history, she gave history of taking tab-metronidazole 400 mg TDS for 7 days and tab-doxycycline 100 mg BD for 5 days. In each episode, she has undertaken this treatment.
Dr.
In
Kiran,
yes, ma'am.
Zoom your presentation.
Is it visible now? Now, ma'am?
Okay, take it.
Okay, then. In surgical history, she has undergone DNC 7 months back. In a menstrual history, there was nothing specific. It was normal without any complaints. Marital status, she was married 2 years back and was separated since 4 to 5 months. In obstetric history, she has history of 1 stillbirth 1 year back and 1 missed abortion. In a general examination, there was nothing specific except there was Agni Mandya since a few months. Her Prakriti was Pitta Pradhan Kafanubandhi. In Ashtavita Pariksha, other things were normal, but she had Kvachit Baddhamala Pravrutti. In per abdomen examination, abdomen was soft and there was mild tenderness in hypogastric region. In her vaginal examination, in inspection, we didn't find any specific changes. In per speculum examination, we found thick, profuse, curdy white discharge, along with inflammation of vaginal mucosa as well as cervical mucosa. In per vaginal examination, there was tenderness in posterior and left fornices, and other organs were normal. In investigation, there was nothing specific found. Coming to the Samprapti, Hetu is regular intake of Guru Abhishandhi Ahar. She was daily having non-vegetarian food like chicken, mutton, and other Abhishandhi Ahar like curd, milk, rice, etc. And she had a sedentary lifestyle due to long hours of sitting in her father's shop. And she also had history of abortion and stillbirth. And in contraceptive history, she had mentioned that there was no use of any kind of contraception. Her lakshanas are Yonigata Shvetasrav, Yoni Pradeshi Kandu, Adyodar Shul, Kati Shul. Samprapti. Due to the Hetu, there was increased Kapha Prakop, there was Sarvanga Kapha Prakop, and there was also Sthanik Khavegunya due to Apan Dushti because of the Baddhamala and history of abortion and stillbirth, due to which there was Sthan Sanchray of that Dushit Kaf in Yoni leading to Kapha Yoni Vyapat. Her Samprapti Ghatak is Dosha is Kapha and Vat, Dushya Rasa and Maunsa, Srotas Rasavaha and Artavaha Srotas, Marga is Abhyantara, Mahabhut are Prithvi and Aap, Udbhav Sthan is Pakvashay, and Vyaktasthan is Garbhashay. and Samprapti Prakar is Atisrav and Vimargagaman. A differential diagnosis can be done of this case with Pittaj Yonivyapad, Kafaj Arthavdushti, and Sannipataj Yonivyapad due to presence of white discharge. Management. First line of management was Nidan Parivarjan, and then we gave her Abhyantar Chikitsa with Pushanuk Churna 1 gram TDS with Tandulodak for 3 months, and Chandraprabha Vati 2 BD for 3 months, and Dashamularis 15 ml BD with Koshna gel for 3 months. Along with this, we gave her Yoni Dhavan with Panchavalkal Kwat Koshna 750 ml for 7 days, and Yoni Pichu with Panchavalkal Siddha Tail kept in situ for 1.5 to 2 hours for 7 days. Patya, she was advised to include Ushnodak, ghee, fibrous food, etc. in her food, and along with she was advised to do Surya Namaskar and daily 30 minutes of walk. And she was asked to maintain personal hygiene with use of clean and dry undergarments. After 3 cycles of Bhaya Chikitsa, 3 cycles of Bhaya Chikitsa was done each month after menses with continuation of Abhyantar Chikitsa. And result, after first cycle, that is after 7 days of treatment, there was mild tenderness in abdomen in hypogastric region, and vaginal white discharge was reduced to scanty, thin, and there was mild tenderness present in posterior and lateral fornices. And with after 3 cycles of the treatment, there was complete relief. Discussion and conclusion. After 3 months of treatment with regular follow-ups and Pathya Ahar Vihar, the patient was relieved with all the symptoms. The Samprapti Bhanga was achieved by relieving Kapha Prakop and improving the Agni and Apan Vayu Karma. Sthanik Chikitsa with Panchavalkal Kwat Dhavan and Panchavalkal Siddha Tel Pichu acted as Stambhana and Grahi, thus reducing the Atisrav. Panchavalkal also acts as anti-inflammatory, analgesic, and antimicrobial. Hence, the localized inflammation was reduced. Pushanuk Churna acts as Grahi, Sravahara, and Stambhaka, and does Kapha Shaman because of its Laghu Ruksha Guna. Chandraprabhavati is considered as a best acting drug and rasayan on Apan Vayu, and it also acts as Tridoshahara Balya Rasayan and helps to reduce the symptoms. The Shumularist is reported to have anti-inflammatory, antifungal, and wound healing properties. It also acts as analgesic and regulates the normal functioning of Apan Vayu. With this treatment protocol, we succeeded in balancing the doshas and breaking the Samprapti Ghatak of this disease, thus giving beneficial result. Thank you.
Thank you very much. Thank you, Dr. Kiran.
Thank you, ma'am.
Dr. K. Savili Gavi, are you here? Hello.
Yes, ma'am, I'm here, ma'am.
Dr. K. Savili Gavi.
Yes, ma'am, I'm here, ma'am.
Okay,
Is
share
it
your
audible? Yes.
Yes, you are audible. Dr. Varsha, please be ready. Dr. Divya Ramgude, please be ready.
Is my PPT visible? Hello. Hello, ma'am.
Hello, doctor. Hello. Are you here? We'll take a break. Dr. Varsha, are you here? Dr. Varsha backward.
Hello, ma'am.
Hello.
Is it audible, ma'am?
Your voice is so low, ma'am. Take a little bit time.
Yes, ma'am. I'm here, ma'am. It's audible now. Hello, ma'am.
Yes.
Ma'am, if my screen is visible, start now.
Yes, it is started.
Okay, ma'am. My sound is audible, no, ma'am.
Yes, you are audible now.
Hello, ma'am. Is it audible, ma'am? Thank you, ma'am.
Yes, you are audible now.
Dhanvantri Namaga. A very good afternoon to everyone present here. Myself, Dr. K. Tilagodi Ammal. I'm here to present the topic effect of Pumsavana Karma in conception. I start with the introduction. Pumsavana Karma is one among the Shodasha Karmas. Shodasha Karma is mentioned in 16 samskaras from the birth unto the Simanta. And Pumsavana comes under the 15th samskara. The ultimate goal of the family is to have a healthy, beautiful, and intellectual child, which is named as the Suputra Kamiya. For this to achieve the healthy progeny, Garbhadharana is the significant role. The formation of a viable zygote by the union of spermatozoa and an ovum is called as the conception. The ideal time for conception is 10th to 16th day of menstrual cycle. It's coming to the aims and objective. According to the Charakam, Pumsavana is the Pumsavana iti Pumsatva Karakam iti Karma. Pumsavana is the procedure done before or immediately after the conception in the time of Pushya Nakshatra to achieve a healthy progeny. Why it is done in the Pushya Nakshatra? It is the best day and is called as the star of the nourishment. That's why in Pushya Nakshatra, Pumsavanam is done. The main aim of Pumsavana Karma or Garbha Dharana. That is, Pumsavana Karma is done before the conception to achieve the conception, and it is indication of the infertility conditions. The second one is the Garbhastirikarana. Pumsavana Karma is done after the conception for proper implantation and stability of the progeny. It is the indication to avoid the abortions. Next, moving on to the material and methods, Pumsavana Karma is prescribed as the pre-conception care or at the time of the conception or at immediately after the conception. Pumsavana Karma should be brought into practice for a planned pregnancy to a healthy child and making the couples well prepared physically, psychologically, socially, emotionally for future events. Next, Pumsavana mentioned in the classics. According to Acharya Shushruta, Pumsavana is done just after the achievement of the conception, Labdha Garbha. According to the Dalhana commentary, there are two indications, mainly two indications: use of inhalation of drugs before the conception. Here it comes the indication of the infertility. The next one is the immediately following the conception is for the proper implantation. Then according to the Acharya Charaka, after conception but before the conspicuousness of the, it is the Vector Garbha. Next, coming to the successful case report of Pumsavana Karma, a female patient aged 28 years was suffering from female primary infertility since 5 years. She is married at 23 years and her marital life is 5 years. Menstrual cycle is regular since menarche. She is a known history of 3 fibroids noted in the posterior wall, lateral wall, and in lower uterine segment. No history of thyroid disease, diabetes mellitus, and hypertension. Menstrual history is 5 days with normal flow and 28 days of interval. No history of clot, white discharge, and dysmenorrhea. Bowels normal, appetite normal, micturition regular, sleep good. She does Shashankasana and Surya Namaskar regularly. All laboratory investigations are normal for patient and her husband. This is the USC report after Pumsavana Karma, a success case. After 3 months of Pumsavana Karma, she got conceived. Pumsavana Karma procedure, according to Charaka, 2 Vatashringa, 2 Danyamasha, and 2 Gaurava Shashaba are taken with the curd during Pusha Nakshatra. Practically, in this case of female infertility condition, I take 6, 8 Masha, 8 Shveta Shashaba, 8 Vatashringa, which is soaked in curd for overnight. In next day morning, this mixture should be pestilled to become liquefied and ready to instill. Procedure, give counseling and explain about the do and don'ts during pregnancy or for conception. Start with local abhyanga with Vadahara Taila and then do Pataspetana. Wipe the face with clean cloth. Now prepare mixture of Dravya, Vatashringa, Masha, Shvetashashava curd, which I mentioned in previous slide, is made ready in a glass. This special mixture is instilled into the right nostril, 4 drops, left nostril, 4 drops, and 2 spoons taken orally. Same procedure is repeated for 3 months on Pushya Nakshatra. Results. This patient got successfully conceived by Pumsavana Karma in Pushya Nakshatra done for 3 consecutive months. Pumsavana Karma should be prescribed as a preconception care and brought into practice for a planned pregnancy to get a healthy child. This method will impart a better result with conception without any side effect and cost-effective treatment as a success rate is high. Discussion. The drugs used in the Pumsavana Karma, due to its Prabhavajanya Karma, it acts directly or indirectly on the HPO axis and stimulates the secretion of the hormones responsible for conception. It gives the action of progesterone, which is responsible for Garbhasthirikarana, and it acts on the HPO axis to achieve Garbhadharana, as well as the medicine which is instilled through the nasal route will act on the HPO axis. And I discuss with the main point. The AYUSH department should set certain guidelines for practice of the Pumsavana Karma with primary and secondary indications to avoid misuse of Pumsavana Karma. I conclude here with the take-home point. A planned pregnancy has to be propagated and given popularity rather than for the purpose of desired sex child by using the Pumsavana Karma. Ayurveda provides the methods of naturally providing healthy progeny by methods mentioned in the Pumsavana Karma. The medicines used here for Pumsavana Karma are easily available, can be easily prepared and administered. So widely used to combat the problems of repeated abortions and infertility, as well as to produce healthy, intelligent, beautiful progeny with strength, vigor, and longevity for future. These are my references. Thank you.
Thank you, madam. Dr. Varsha Gaikwad, please share your screen. Dr. Varsha Gaikwad. Dr. Divya Ramgude. Dr. Divya Ramgude, are you here? Dr. Divya Ramgude. Dr. Varsha Gaikwad. So thank you very much. Thank you very much for all the participants and faculties and the students for the presentation. I hand over the session to Dr. Saili Pastana.
Thank you, Dr. Upadhyay ma'am. Thank you, Dr. Ashok Wali sir. Thank you all the participants for your presentations. We will take few minutes in which our judge, Honorable Principal Dr. Ashok Wali sir and Dr. Upadhyay ma'am will select 3 best papers and we will announce it.
Hello. 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 उनको आवाज ही नहीं जा रहा। आप ये मोबाइल दे दीजिए, बच्चे मैडम बात करेगा।
Hello. Hello.
But my PPT is there on this.
Hello. Hello. We are DY faculty. Hello. Hello. Am I audible, madam? Hello.
Yes, ma'am, you are audible.
Yeah, actually we are DY faculty. We have some technical issues. Just give us 5 minutes. Both the presenters are ready here. Dr. Varsha Gaikwad and Dr. Divya Ramugode. Please give us 5 minutes, madam. Because we are waiting since long, madam. Just give us 5 minutes.
Okay, okay, ma'am. Dr. Divya ma'am.
Yes, yes, ma'am. Just give us
Okay,
5.
share your PPT, ma'am.
Okay, okay. Madam, तुम्हाला दिला तरी तुम्हाला
Hello.
Yes.
Madam, please allow me to share my PPT.
Shubham Rathod. Yes, yes. 1 minute, ma'am.
Shubham Rathod. Hello. Shubham Rathod.
Yes, ma'am.
Dr. Varsha Gaikwad.
Dr. Divya ma'am.
Hello.
हाँ ma'am.
Am I audible?
Yes, yes, ma'am. Please share your PPT, ma'am.
Hello.
Hi, yes, ma'am.
Madam, we are ready.
Yes, yes. Share your PPT with us.
Yes, ma'am. Just a minute.
Yes, Varsha ma'am. Your PPT is visible.
Hello. Am I audible, madam?
Yes, yes.
Okay. So, hello everyone. Myself, Dr. Varsha Gaikwad Anand, Associate Professor in the Department of Shri and Prasuti Tantra, DY Patil School of Ayurveda, Neeru. My today's topic is aesthetics in Ayurveda with special reference to breast augmentation. The word aesthetic means, just a minute, madam, let me bring it with the slideshow. The word aesthetic is synonymous with beauty, and here we are focusing on the physical beauty. Why? Because nowadays, lot of youngsters are under pressure to look good and maintain a perfect body physique. But unfortunately, not all are blessed with the perfection. Many of the youngsters fall prey to body image complex. What is body image complex? That we will see in the later slides. But in Ayurveda also, small breasts are narrated as Stan Asampat by Sushrutacharya. This study is an attempt to provide an economical remedy for breast augmentation. Need of the study. Body image complex is a phenomenon wherein people are not happy with the way their body looks, and as a result of which they are disturbed psychologically. The incidence of body image is whopping 71%. The only authentic remedy available for
Hello.
for breast augmentation is breast
Hello,
implant.
excuse
But
me. Your slides are not going forward, please. I'm still seeing the starting. That's okay.
Is it okay?
Yes, yes.
Okay. So coming to the aims and objectives, the aim of the study was to decide the clinical efficacy of local application of Kasisadityl in breast augmentation. The objectives were to review literature related to breast development with special reference to breast hypoplasia, to prepare formulation of Kasisadityl and to standardize this, to assess the safety of Kasisadityl in female patients suffering from breast hypoplasia, to assess with the duration of study, that is 60 days, and duration of local application, that is 12 minutes, for each breast is sufficient to get the optimum result. Review of literature. Breast as per modern, breast has small, very quickly under based and they need medical advice for the causes of breast and in the gland. Ayurvedic view. The following are the conditions where underdeveloped breasts are directly or indirectly cited in Sanhita. In Sushruta Sanhita, ideal breast is described to be not too big or not too small. In Charak Sanhita, feature of astani, that is undevelopment of breast, has been narrated in Shanti Yogi Papat, and Shripan Siddha oil has been narrated for enlargement of breast. Concept of Abhyanga. In Dalhan Tika of Sushruta Sanhita, it is narrated that if the Abhyanga is done for 300 matra, it will reach to Roma. Then if 400 matra to Rasa, 500 matra to Rakta, and so on and so forth. So by 12th minute, the Sneha will reach to the Mamsa, Meda, Dhatu, which are the primary composition of breast tissue. Review of previous work done. Though there are many Ayurvedic products which claim to cause breast enlargement, unfortunately, there is not even a single scientific research study to support the claim. These are the modern works that are done previously. The first is non-surgical breast enlargement using an external soft tissue. That itself indicates that even modern medicine is in search to provide an remedy which is non-surgical in nature. Material and method, preparation of standardization of Kasisadityl and assessment of efficacy of local application. Study design included sample size of 60 patients. Inclusion criteria, nulliparous patient from 18 to 35 years old and females having breast size less than 32 inches and those who are willing for breast augmentation. Exclusion criteria was patient with less than 18 years and more than 35 years, pregnancy and Paris woman, patient with history of fibroadenoma, cystic breast disorder, mastitis, etc. Method of application, patients were trained to do local application of lukewarm Kasisadityl over breast for 12 minutes at night for period of 60 days with follow-up after every 20 days. These were the assessment tools that were used. Breast size in inches before treatment and after treatment with follow-up after every 20 days. This is a unique breast hypoplasia rating scale, that is BHRS. The grade 0 is having more than 32 inches. Grade 1 is breast size between 31 to 32 inches. Grade 2, 28 to 30.9 inches. And grade 3, 26 to 27.9 inches. Statistical analysis of the study revealed the age distribution of the patients between 21 to 30 age group patients were more affected or more conscious from the aesthetic point of view of small breast, and those were the patients who approached us for the treatment. Sharir Prakriti wise, majority of the patients were belonging to Vata Pitta category, obviously because we all know that Vata dosha is related to Dhatu Kshaya, and breast hyperplasia is nothing but a Kshayavastha of Dhatu. Statistical analysis revealed that the p-value was less than 0.001%, which is extremely significant statistically. DHRS score before and after treatment. Before treatment, all the patients were having DHRS score of 2, but we can see clearly that after treatment, the score has we can see the score has been reduced to 20, and even to 20 patients were having 1 score, and 5 patients were having 0 score. Overall assessment of the therapy. Out of the 60 participants, 4 participants showed marked improvement, that is breast size increased from 3 to 3.9 inches. 16 participants showed moderate improvement. 32 participants showed mild improvement, and in 8 participants there were no change observed, and these were the patients who were belonging to more than 30 age group. Statistical test applied was chi-square test, and p-value was extremely significant from statistical point of view. Discussion: probable mode of action of oil massage. In Sushruta Samhita, Abhyanga, that is local application of oil, has been cited to lead to Dhatu Pushti. Breast tissue is primarily composed of fat tissue, that is Meda Dhatu. So the application of Kasadi oil in breast augmentation is justified. Again, another theory to support the claim. Vata Prakop leads to Dhatu Kshaya. Vata dosha resides in skin. Oil is the best remedy for Vayu, and hence Abhyanga with tail leads to Vata Shaman, and that in turn leads to Dhatu Pushti. Modern view of the same. Modern view of dermal absorption. The skin is relatively permeable to fat-soluble substances and relatively impermeable to water-soluble substances. Essential oil molecules are so minute that when they are applied to the skin, they are able to pass through the stratum corneum, that is the outermost layer of the skin. This is the composition of Kasisadi oil, Shatavari, Ashwagandha, Gajapippali, and Kasis. Shatavari, as we all know, it leads to the increase in the Sanya level also by virtue of its Madhura Ras, Shita Virya, and Madhura Vipak, it leads to Dhatu Pushti. Ashwagandha, again, Madhur and Tikta Ras leads to Dhatu Pushti, and also it is associated with good quality of Shukra Dhatu, and breast being the secondary sex organ, Ashwagandha has definitely effect on breast augmentation. Gajapippali is narrated as a Vata Kapahara that leads to the breast augmentation. Kasis is narrated as Vata Kapahara and Kshaya Rogahara. That's why breast augmentation can be achieved. Conclusion: Kasisadi Tail Abhyanga by its properties leads to Dhatu Pushti of Mamsa, Meda, and Shukra Dhatu, leading to breast augmentation. It is a safe, non-surgical, economical remedy for breast augmentation. The duration of study, that is 60 days, is sufficient to cause breast augmentation. At last, thank you, and I would like to extend my heartiest thanks to all the organizers for giving this opportunity to me. Thank you so much.
Thank you so much, Dr. Varsha Gaikwad, ma'am. Now I request Dr. Divya Ramugde, ma'am. Please share your PPT.
Yes, madam. एक मिनट ना पीपीटी शेयर कर रही हूँ.
Okay.
एक मिनट ना.
मॅडम तुमच्यासारखं केस सारखं पडलंय. वारंगातीची पण एक एकच ना आणि ती एक एक लक्ष्मीनाथची.
Now PPT is visible.
3 वेळा आणि उपयोग 2-2 चमचे 3 वेळा.
PPT is visible.
Not yet, ma'am.
Meeting joined up. Mobile से करो क्या? Okay. Now it is visible.
No, ma'am. Yes, yes. Now visible.
यहाँ से आवाज नहीं आता. नहीं बोलो. अच्छा. है नको ना. आवाज नहीं आ रहा है. Hello.
Yes, ma'am. Please continue.
Okay, okay. Sorry for late.
Okay.
Good afternoon, one and all. Myself, Dr. Divya Ramugade, HOD and Professor in Preconception Department at DY Patil Ayurved College, Nerul, Navi Mumbai. Here, I am going to start with my presentation. And this was my PhD work where I have found effective results. That is the reason I would like to share one case study with you all. The topic is a case study on efficacy of Rasayan Churna and Pranayam in the management of Rajanivrutti Janya Lakshanas with special reference to postmenopausal syndrome. Next. These are the contents of my presentation. Patient age of 50 years came with chief complaints was a dryness of vagina, dementia, insomnia, bilateral knee joint pain, lower backache, decrease in concentration, loss of libido since 2 years. History of present illness. Patient was apparently normal 2 years back. Later, she developed with the above symptoms. For the better management, she came our hospital. Next. There is a poor network problem actually. Only one. It is visible?
Yes, ma'am.
Okay. Nothing significant in past and family history. As we all know, this is a case of postmenopausal syndrome having menopause 2 years back. That was in 2017. And coming to the coital history, she has painful coitus due to increased in dryness of vagina. There are the reports, but there was no significant change. This is general condition and systemic. This is general examination and systemic examination. General appearance having unhealthy look with mentally depressed and irritable nature. On PV examination, uterus was senile, atropic, mid-post, mobile, forness is clear, but increased dryness of vagina noticed. Therefore, my final diagnosis was Rajanivrutti Janya Lakshanas with special reference to postmenopausal syndrome. Now coming to the Samprapti part, Rajanivrutti is nothing but a physical condition where we will see in Jara Avastha condition. In Jara Avastha, Vataruddhi will be there, Kafakshay will be there, Pitta also declines, which causes Agnimandya. We will see the effect on metabolism of dhatus, which causes Dhatukshay and Upadhatu Rajakshay, which is leading to Rajanivrutti. So, based on our concept of Samprapti, I have concentrated my treatment plan for increasing the metabolism of dhatus. Therefore, I have taken Rasayan Churna in my treatment. It was given 6 grams twice a day before food with growth, and also advised daily practice of pranayam was chosen. Total duration of the treatment was 12 weeks. Now coming to the discussion part, Rasayan Churna is a classical Ayurvedic formulation which contains guduchi, amalki, and gokshur. Rasayan Churna is the measure to obtain good quality of dhatu, which destroys aging process. It improves immunity. It improves defense mechanism against free radicals. It enhances general body resistance. So it can be assured that Rasayan Churna along with pranayam would be effective in relieving postmenopausal symptoms in female patients. I have prepared a scale which I have taken from elsewhere publication from the year to 1996. This is that the scale which is divided into 4 categories: vasomotor symptoms, psychological symptoms, physical symptoms, and sexual symptoms. Vasomotor symptoms are night sweats, hot flushes, sweating. Psychological symptoms are anxiety, dementia, feeling depressed, impaired memory, and wanting alone. Physical symptoms are flatulence, joint pains, feeling tiredness, insomnia, frequency of urgency micturition, dry skin, etc. And sexual symptoms are loss of libido and vaginal dryness during coitus. Based on that scale, these are basic findings in the present study. Vasomotor symptoms not found before and after treatment. Psychological symptoms and physical symptoms were high before treatment, that is 8 and 13. There was significant relief in symptoms and got reduced to 5 and 8 by 12th week. There was very mild relief in sexual symptoms. So, Rasayan Churna and Pranayam found to be effective in this particular case study. Ayurveda offers effective modalities and hereby formulations for the management of postmenopausal symptoms without any side effects. In this study, formulations having Deepan, Pachan, Anuloman, Shodhahar, Rakta Prasadan, Balya, and Rasayan properties. Pranayam also improves physical and mental health also. These are the previous research work done on this topic. These are the references. Thank you for giving me this opportunity. Thank you.
Thank you so much, Divya ma'am.
Very much disturbance. Unmute.
Dr. Divya ma'am, please mute.
Okay, okay.
Okay, ma'am. Thank you.
आणि अजून ऑर्डर करायची लागते बिल टाकते हे सगळं मी तुला अडकेल ते काय फीडबॅक भरल्याशिवाय सर्टिफिकेट नाही मिळणार ना
प्रज्ञा मॅडम
बाकी काही आवाज होत
बक्षीस तर काय मैं अपेक्षित
हमारे नहीं है ना,
उन लोगों का आवाज इतना आता है कि हम नहीं कर पाते. डॉक्टर दिव्या मैम प्लीज. Okay, ma'am. Thank you so much, all of you. Now I request Dr. Anjali Upadhyay, ma'am, head of our research department, ADMC Ashta College, to announce best 3 papers. We will take few minutes. Result will be announced after 5 minutes. Please be patient.
Thank you so much for your patience. Results are ready. I request Dr. Anjali I request Dr. Anjali Upadhyay ma'am, Head of Research Department ADMC Ashta, to announce the result.
So good afternoon, everybody. First of all, I want to congratulate all of the participants. They have taken the keen efforts to come here and give the presentations, as well as per the organizer. I will congratulate to this particular SUPRAJA 2022. It is a national webinar organized by the Department of the Gynecology, Department of the Shri and Prasuti Tantra. I congratulate Dr. Dilip Katre sir, who is the HOD of the department, as well as I want to congratulate to the organizing secretary, Dr. Tinku Ganesh Kalche, and all the faculties, other faculties, Dr. Sali Pashte, Dr. Nisha Panalkar, Dr. Radha Fadnis, and all the PG students. They have been helped him for the success of this particular national webinar. So I came here to announce the best research paper awards. So I know that you are very much enthusiastic about this particular awards, but I want to say you that the presentations are really good. And the thing is that already I got your research papers already. So we studied it and we have the research paper awards over here. In the faculty group of the SUPRAJA 2022, I want to announce the first of all consolation prizes. The consolation prize goes to Dr. Prerna Bandekar, ADMC Ashta. So please give just raise your hands on the chat box so that we will congratulate like this. The second prize goes to Dr. Samir Golab, SMBT College Nashik. Dr. Samir Golab, SMBT College Nashik. The first prize goes to Dr. Poonam Khod, Himalaya Ayurvedic College Dehradun. Himalaya Ayurvedic College Dehradun. All the participants will get the trophies and the certificates by soon. Okay, we keenly congratulate all of them to have a great research work and the great research results they have been presented over here. So again, congratulations to all, Dr. Poonam, Dr. Samir and Dr. Prerna. I basically myself congratulate you all. Now the second group of the PG students group, I want to congratulate here for the consolation prizes. The consolation prizes goes to in the division of Dr. Shraddha Bhuvad, Sayan Ayurved College, Mumbai, and the Dr. Kajal Modhave, VNH Ayurved College, Rahuri. So I congratulate you, Dr. Shraddha and Dr. Kajal. So the PG student group second prize goes to Dr. Mayur Mukunda, SSAM Ayurved College, Hadapsar, Pune. Again, I announce Dr. Mayur Mukunda, second prize goes to Dr. Mayur Mukunda, SSAM Ayurved College, Hadapsar. And the first prize goes to Dr. Vaishali Arti, ADMC Ashta. So in the student group also, I congratulate all the students that they have been taken such efforts and presented a nice case studies. And whatever the case studies and the research articles, they have been sent to us. And according to their presentations, we have this particular results. So congratulate all of them. On behalf of this, Dr. Tinku Ganesh Kalche want to say the few words according to research article. So I hand over the session to the Dr. Tinku Ganesh Kalche.
Good evening, all of you. First of all, I congratulate all the participants of paper presentation, without whom this webinar would have been conducted properly. Because of you, this webinar got that much weightage. Thank you once again. And I congratulate all the participants who got prizes. And don't mind whoever have presented the paper and who didn't got any prizes, they will also be received certificates. Don't mind. Next time you prepare well And once again, thank you.
So thank you, sir. Thank you, sir. Actually, as per the announcement, all the research papers and articles has been published in the Journal of Indian Journal of the Applied Research. It is actually www.ijooar.com, which is a journal, which is a peer-reviewed quarterly journal, international journal, and it has an impact factor of 4.71, having the ISSN number as well as the scientific research journal number at 0.91. So all the participants, they have been presented, they have been sending us research articles that has been published in this particular our college journal. The second journal, it is a SUPRAJA international journal, which is having the also index journal having the ISSN number. But all the articles will be published soon, and suppose if there is any query, then we will review it back to you. And now I hand over the session to Dr. Prerna ma'am.
Thank you so much. Okay, ma'am. Thank you so much, Dr. Anjali Upadhyay, ma'am. Now I request our organizing secretary, Dr. Tinku Ganesh Patel, sir, for vote of thanks.
Thank you all. First of all, I am very much thankful for patrons, Honorable Shri Annasaheb Dange, Honorable Shri Rajendra Dange, and Professor Shri R.A. Kanai sir. I extend my heartful thanks to Vice Chancellor of MHS Nashik, Dr. Kanetkar Madam, as well as Registrar Dr. Kalidas Chavan sir. I am very much thankful to our Chief Guest, Dr. Neeta Mahesekar Madam. I extend my thanks to our eminent speakers, Dr. Yogesh Joshi sir and Dr. Gayathri Bhat Madam. I am heartily thankful to our beloved principal, Dr. Wali sir, who is also our organizing chairperson. And last but not the least, I am thankful to all participants, faculty members, practitioners, and most importantly, our team members, PG students, for their lovely support for this webinar. Once again, thank you all. Feedback form will be sent on group created, WhatsApp group, and also it will be sent on registered email. So I declare this webinar now finished. Thank you.